Wow, it's almost like I called for a minute of silence or something. It wasn't intended to hide. My name is Rick Estrada, and I serve as President and CEO of Metropolitan Family Services. I'm also obviously a commissioner here of the Illinois Accountability Commission. On behalf of all of us, we want to thank you all who took the time to come here and to witness, listen, provide testimony, both the expert testimony and the community testimony. We are in your gratitude. And for everybody who's watching this online, thank you for joining us. I had the pleasure of doing that at the last time, and it worked almost seamlessly. So thank you for joining us on that medium as well. So as I said, I'm Rick Estrada. For more than 3 decades, my professional life has been invested in strengthening families and communities. First as a practitioner, then as a leader in city government and community service organizations, and now at an agency with a 168-year history of excellence that serves more than 200,000 families and individuals every year across the metropolitan area. At Metropolitan Family Services, our work is rooted in both evidence and experience. We serve parents raising children under pressure, young adults working towards stable employment, seniors navigating isolation, survivors of domestic violence and gun violence, and families turning to us for counseling, legal services, workforce support, and mental health care. Our mission is to foster strong, resilient families and communities, and that work depends on stability, trust, and the ability of people to move through their lives without fear. Over the past year, as federal enforcement operations such as Operation Midway Blitz unfolded in our communities, our staff began noticing certain disturbing patterns. Clients missing appointments, parents asking whether it was safe to travel to school, schools asking for support, young people expressing anxiety that a caregiver may not return home, community partners noticing sharp declines in engagement and participation. We see it every day. Families thrive when they have support, trust, and stability, and struggle when fear dominates daily life. Fear disrupts school, work, community life, causing withdrawal from institutions and eroding overall safety. When force, particularly lethal force, is used, the public cannot rely on press releases or arrest statistics alone. There's a right to examine outcomes, impacts, and consequences. The current administration has described operations like Operation Midway Blitz as efforts to make communities safer, removing the worst of the worst, restoring public safety, and protecting residents. That language shapes perception and justifies significant government power. But when safety is invoked to justify action, that claim demands evidence. In human services, we measure safety differently by whether families can thrive, whether children can go to school without fear, whether parents can go to work without worrying about whether they will return or not, whether neighbors trust institutions enough to call 911, and whether they can rely on police to uphold their oath to defend and protect us. If safety is strengthened, we see continuity in daily life, not disruption. Instead, providers reported missing appointments, educators observed drops in engagement, families withdrew from institutions they once trusted. The question before us is straightforward. Did these enforcement actions produce measurable improvements in community stability and trust, or did they generate instability, distrust, and lasting harm? This hearing exists to test the federal claim of safety through evidence, testimony, and lived experience, examining 4 domains with observable indicators. The first one will be health, mental health, and social well-being. Secondly, education and youth stability. Third, public safety and community trust. And finally, economic vitality and household stability. This is about building a record grounded in institutional and lived experience from those who serve families daily and respond to the consequences of federal enforcement. We must acknowledge the broader climate in which this conversation is taking place. There have been reports and concerns that the Department of Homeland Security has sought information related to individuals and organizations posting about or tracking activity by U.S. Immigration and Customs Enforcement. Whatever the stated purpose for those requests, practitioners across communities describe a growing chilling effect. Uncertainty about whether documenting impacts, speaking publicly, participating in oversight conversations could invite additional scrutiny, unintended consequences. For some institutions, that uncertainty extends to concerns about reputational harm, strained federal relationships, or potential funding implications. Different organizations have had to weigh those risks in different ways, and we respect the complexity of those decisions. You are grateful for those who are willing and able to lift up their voices today and contribute to the public record. We are heartened to see congressional hearings beginning to examine what occurred in Chicago and Minneapolis, including the tragic killings of Renee Good, Alex Preddy, Silvero Villegas Gonzalez, and the shooting of Marimar Martinez. In March and April, we will hear more testimony and review the evidence in the cases of Marimar Martinez and Silvero Villegas Gonzalez, and in other instances of federal enforcement use of force. And Congress must do more to hold those responsible accountable to fully capture the harm and the lasting trauma our communities have endured, and to take action to end these federal enforcement operations that continue to terrorize families and neighborhoods across our country. But today we are here in Illinois to do our part, to lift up the stories of families, service providers, educators, community leaders who experience the ripple effects of these operations firsthand. Their experience show what federal enforcement really means for our communities, and their voices must guide how we build accountability, transparency, and real safety. Accountability is not anti-enforcement. It is pro-community. It is pro-democracy. It is necessary when government power has profound consequences. But before we begin, I want to share a few important notes to ensure today's hearing is accessible, respectful, and safe for everyone. Real-time translation services are provided through our partners at the Illinois Coalition for Immigrant and Refugee Rights. Thank you. ASL services and closed captions are provided. We ask that all participants respect one another, even when emotions run high. This is a place for truth-telling and not a place for intimidation. Today's meeting will include images, testimony, and public comment that may be difficult to witness or to hear. Please take care of yourself and step out as needed. Exits and restrooms are clearly also marked. This morning, we will move through these 4 areas in sequence, hearing from experts and directly impacted individuals in each domain. We will hear 12 subject matter experts representing institutions, community organizations, and directly impacted individuals. We will take then a 10-minute intermission at approximately 10:25. Finally, at around noon, we will open the floor for public comment because this commission exists not only to examine the issues, but also to listen. So, panel 1 will be on health, mental health, social well-being. We will begin with health because it's often the truth that surfaces first. Today's panel examines how enforcement operations affected families' access to care, starting our work to test the federal claim that these actions make communities safer. If safety were strengthened, we would expect stability in daily life. Residents and families able to access healthcare services readily, continuity in care and preventive services, children feeling secure and supported in their health and development. Instead, providers reported missed appointments, delayed preventive care, rising anxiety, and children carrying toxic stress. This panel examines physical health, mental health, family stability, showing how fear shaped access to care. These impacts are not peripheral, they are evidence. So we are going to have 4 expert speakers, beginning with Dr. Meenal Giri. She's an expert, a medical doctor, expert in pediatric health, child well-being, and she will be using a DECASA presentation. She will present for about 10 minutes, and she will be followed by Dr. Rebecca Ford-Paz, again, following a similar format. She is an expert on mental health, trauma, and toxic stress. And then we will hear from Dr. Karen Susan Haverkamp, who is also an MD and an expert in pediatric care, healthcare, and disruptions. So let us begin. Dr. Giri, we'll begin with you. Thank you for being here, first and foremost.
Thank you. Good morning, everyone. It's an honor to speak to you today. And thank you for the work you are doing to document the impact of ICE activities on Chicagoans. My name is Meenal Giri. I'm a pediatrician specializing in asylum medicine and executive director of the Midwest Human Rights Consortium, or MHRC. MHRC serves as a regional hub connecting attorneys with medical and mental health professionals who conduct forensic evaluations for individuals seeking humanitarian protection. I'm here because our network provides me visibility across multiple institutions, clinicians, and case patterns in Illinois. What we are observing locally mirrors national data. It's not anecdotal, it's structural, and it is creating measurable harm to children and healthcare systems. Next slide, please. Thank you. Sorry. So my colleague, Dr. Haverkamp, will show you what's happening in the exam room, but I'm here to describe how enforcement activity is disrupting healthcare delivery through 2 distinct mechanisms. The first is institutional presence. Enforcement activity occurring in or around healthcare settings, creating fear that deters families from seeking care. The second is direct interruption of care, when parents or caregivers or even the children themselves are detained or deported, collapsing a child's treatment plan. These are not theoretical concerns, these are clinical realities. I'll describe the impact this is having on healthcare workers and what's happening when healthcare institutions remain silent instead of speaking out and documenting the harms. And since there is no systemic documentation that I'm aware of, I'll offer some general patterns that we're seeing through the MHRC referral hub, which can shed some light on the issue. And finally, I'll end with suggestions of measures we can put in place to protect patients and families. Next slide, please. The first mechanism I mentioned is the institutional presence of ICE and CP within the healthcare system itself. ICE agents have been known to conduct enforcement activities in or near healthcare facilities in Illinois, creating a chilling effect that deters immigrant patients from seeking necessary care. Families, as mentioned earlier, report being afraid to bring medicines or even to send them to school after seeing immigration agents in hospital parking lots and helicopters hovering over daycare centers and high schools for hours on end. One family was chased through the parking lot of a federally qualified health center in Chicago in broad daylight. These actions create widespread fear that keeps families from seeking care. These are terrified. Next slide, please. A survey conducted by the Physicians for Human Rights confirmed direct ICE or CP presence inside healthcare facilities is having an impact on healthcare delivery. This institutional presence further undermines public health by discouraging patients from accessing care when they need it. This can lead to delayed treatment, missed immunizations, and worsening chronic conditions. But in pediatrics, delays can be deadly. For an infant sick with a viral illness, this can quickly lead to respiratory failure. A simple flu can quickly progress to a fatal pneumonia, and the late diagnosis of meningitis can mean lifelong brain damage to a child. Next slide, please. Families have been forced to make the impossible choice of leaving their medically complex children at the emergency department alone. These children, already facing immense challenges, are now robbed of the comfort and care of their loved ones. Clinicians are now caring for these children whose parents are detained, attempting to discharge medically complex patients with no legal guardian available, and worrying that even calling a parent for consent could expose them to arrest. Hospitals are turning to emergency guardianship and ethics consultations at the very moments when they should be focused on healing critically ill children. And some children are dying in hospitals alone without their parents. Next slide, please. The second mechanism I'd like to discuss is direct enforcement actions by ICE and CBP. As a pediatrician caring for immigrant families, I'm witnessing an unprecedented crisis. Children's medical care is being disrupted because their parents are detained or deported by ICE, sometimes in the middle of their child's chemotherapy. When a parent is seized by ICE, a sick child's entire care plan collapses. Medications go unfilled, transportation to the hospital disappears, the insurance coverage lapses. The caregiver and medical decision maker at the bedside is suddenly missing. For a child with asthma or diabetes, this can mean an emergency hospitalization. For a child with cancer, it can mean losing their chance at survival. And for medically fragile children, children who rely on ventilators or feeding tubes, the consequences can be fatal. Without two trained caregivers to manage complex equipment, families may be forced to choose to withdraw life-sustaining treatment or send their child to a long-term facility. And sometimes this might mean a child who could have gone on to live at home instead goes home to die. Next slide, please. These are actual quotes from healthcare workers at a hospital near the Broadview Detention Center. This past fall, agents used this location as a de facto field hospital during their enforcement operations. Clinicians fought policies which conflated the criminal justice system with a lawless immigration enforcement campaign. The constant presence of enforcement impacted healthcare worker morale. ICE was bringing people in who were injured during apprehension and not leaving their sides, going into exam rooms, refusing to leave. There's documentation of a pregnant woman held in shackles, men parading through the emergency department armed with rifles. And the people who told me this did not feel safe coming to testify today. Next slide, please. When immigration enforcement is physically present at the bedside or creates a hostile environment outside medical facilities, it compromises privacy, clinical judgment, and trust. Next slide, please. Hospitals are meant to be neutral spaces. Patients expect privacy, safety, and care, not fear. Under the Emergency Medical Treatment and Active Labor Law, physicians must provide emergency care regardless of citizenship, legal status, or the ability to pay. We also swore an oath to treat all patients with dignity and respect. When enforcement activity deters patients from seeking care or interferes at the bedside, it threatens both patient safety and compliance with the federal law. But this is also about something deeper. We took an oath, and the oath does not change based on documentation status. Next slide, please. In all fairness, hospitals are afraid too. They fear federal funding retaliation, legal liability in ambiguous jurisdictions, reputation damage, community backlash from multiple directions. Minnesota clinicians, however, pictured in this photo here, they stood up in front of cameras and told the truth about what is happening to their patients. That leadership created clarity and accountability. Chicago's medical institutions have the same opportunity and the same responsibility. When institutions remain silent, clinicians are left trying to reassure families without any backing. So what is our role? We affirm patients' rights and dignity. We document the disruption of care, patterns of missed appointments, delayed treatment, and medical deterioration are not anecdotes, they are evidence. And we testify, like we're doing here today. We create a public record. Accountability does not happen in the dark. Next slide, please. While we lack comprehensive hospital system data, as Executive Director of MHRC, I oversee forensic evaluation requests coming through our referral network, and these requests tell a clear story. First, detention is triggering medical and psychiatric crises. Individuals with trauma histories are deteriorating in custody, unmedicated, untreated, separated from family. Clinicians are asked to urgently document risk just to secure release, and that's for the lucky ones. Second, U.S. citizen children are experiencing measurable harm. We are evaluating children with anxiety, depression, and other symptoms, often meeting the legal threshold for exceptional and extremely unusual hardship. For example, we've been asked to document a case involving 2 young U.S. citizen children whose father faces removal while their mother has an advanced form of cancer. And we must determine what hardships these children would endure if he is deported. Third, the burden has shifted to clinicians. Requests are more urgent, more complex, and time-sensitive, and volunteer systems like MHRC are overwhelmed. Next slide, please. As I close, let me be clear. When helicopters circle over neighborhoods, when flashbangs explode before dawn, when armed agents enter residential buildings, children are watching. Their nervous systems absorb that fear. Their bodies absorb that stress. We cannot normalize that. I co-wrote the American Academy of Pediatrics resolution calling for transparency whenever children are harmed during militarized operations, and for an end to the tactics that place children at risk. Because children are not collateral damage. They are patients. They are developing humans. They are future adults whose health trajectories are being shaped right now. And the health and safety of children must come first. All children. Next slide, please. So a few recommendations. Protect children in active medical treatment. Establish clear guidance that critically ill children receiving medical care should not be subject to enforcement action. Create mechanisms for medical providers to advocate for treatment continuity. Develop protocols for when enforcement threatens to disrupt ongoing care. Support healthcare institutions. Clear protocols for facilities navigating enforcement encounters. Transparency requirements. Facilities should report enforcement activity to state health authorities, and reporting mechanisms should be in place to protect patients, providers, and staff. Protect the providers. Clarify legal obligations and protections for doctors and clinicians. Institutional support for addressing their moral distress. Protections for providers who document what they witness. And then finally, data infrastructure, systematic tracking of enforcement-related healthcare disruptions, monitoring population health indicators in communities with high enforcement activity, and create early warning systems for public health impacts. As a colleague said, we are witnessing the creation of a generation with preventable trauma, delayed diagnoses, foregone treatments, and compromised development. Dr. Ford-Paz will speak more to that, but I will leave you with this. Healthcare settings must remain safe healing spaces. No parent should have to choose between their child's health and their family's safety. No child should die in a hospital without a parent by their side. And finally, the words of brave Dr. Janet Gawartz O'Brien, President-elect of the Minnesota chapter of the American Academy of Pediatrics. Protecting kids is not a political act. It is a moral responsibility that we all share. Thank you.
Dr. Geary, thank you so much for that testimony, and your recommendations and all of your comments were taken into consideration and into the record. We now ask Dr. Rebecca Ford-Paz to speak. The commission will have an opportunity to ask questions after all three presentations. Thank you.
Thank you, Chair and members of the Commission, for your time today. The efficacy of mental health care relies on the ability to establish trust, safety, and confidentiality with the communities that we serve. When those foundations are shaken, care is disrupted, causing both immediate and long-lasting impact. I'm a bilingual licensed clinical child psychologist specializing in immigrant and refugee mental health. I'm also a citizen of the United States, descended from refugees, and a resident of Chicago, Illinois. I'm here today on behalf of the Coalition for Immigrant Mental Health to speak about the impact of current federal immigration enforcement policies and practices. To protect families and institutions, I will share anonymized, aggregated observations from clinicians across our statewide network, and any patient stories will have details changed to protect their identities. Our goal is to protect both immigrant and refugee communities and the institutions serving them, while ensuring that the public understands the real and urgent impacts current federal enforcement practices are having on mental health care delivery in our state. When discussing immigrant and refugee mental health, we have to consider that traumatic experiences occur across the three stages of migration: before migration, during the journey, and after arrival. More and more, migration is happening not for reasons of economic opportunity, but for survival. Many immigrant children and families are fleeing violence and persecution. During migration, they endure life-threatening hardship, and after arrival, they face chronic stressors such as poverty, discrimination, and the fear that at any moment they may be deported back to the dangerous conditions that they fled from in the first place. That is to say, what happened in Midway Blitz did not occur in a vacuum, and is just another layer of trauma for immigrant families. With increased exposure to traumatic stressors, forcibly displaced individuals are at increased risk for post-traumatic stress, depressive, anxiety, and psychotic disorders compared to the general population. However, numerous barriers to care for this population have been identified even prior to escalating immigration enforcement actions, including competing demands to meet basic needs, lack of insurance, lack of culturally and linguistically appropriate services, low mental health literacy, stigma about mental health help seeking, and mistrust of authorities and institutions, and public charge policies that are rapidly changing and fuel confusion and fear that accessing public benefits may jeopardize future pathways to citizenship, leading many families to go hungry and without adequate medical care. When Midway Blitz occurred, we saw how fear can become a social determinant of health. Families reported heightened economic hardship due to reduced hours, wage loss, and deportation of breadwinners. In turn, we've seen exacerbations in housing and food insecurity, inability to pay utilities in the darkest and coldest months of winter, and the loss of medical insurance coverage. Whereas before there was already significant barriers to accessing care for immigrant families, now patients are not attending doctor's appointments and not going to pharmacies to fill essential prescriptions due to fear of detention and deportation. Although many of our providers reported converting appointments to telemedicine, some noted that patients' conditions could not be handled virtually, prolonging their illness and injury. One pediatric psychologist talked about a 10-month-old patient who has had prolonged hospitalization since birth due to complex medical needs, including respiratory failure requiring a tracheostomy. Due to the immigration crackdown, his mother expressed fear to leave their house. Parents holding and supporting babies in the NICU is not only supporting the infant's social emotional development. Research has shown that caregiver support improves medical progress. We are doing everything we can as a medical and psychosocial team, but nothing can replace parents being able to be with their babies. Another pediatric psychologist talked about children in the hospital misinterpreting why caregivers were not visiting, leaving them to think, my parents don't love me, and resulting in increased depressed mood and disruptive behavior while hospitalized. In our communities, U.S. immigration officers' use of local and national law enforcement uniforms has blurred distinctions among authorities, eroding trust between communities and police and medical responders, making it less likely for people to call for help when immigrant children and families are the victims of crimes, domestic violence, and child abuse. Kids need to be in school, but the threat of family separation has contributed to school absenteeism, academic disengagement, and heightened emotional distress. Missed school days translate into academic decline and lack of access to essential developmental support services like learning specialists, occupational therapists, and school-based mental health professionals. Immigrant students also report increased bullying, being threatened by peers that they're going to call ICE or that they should just self-deport. Research has clearly demonstrated the short and long-term negative impacts of immigration enforcement on health and mental health. But we know that of all the things that can happen to a child, forcible parent-child separation is one of the most terrifying and damaging. Real and threatened forcible parent-child separation is a recognized adverse childhood experience which contributes to toxic stress, disrupted brain development, and increased lifelong physical and mental health risks. The fear generated by Midway Blitz extended far beyond those detained. Over 6 million U.S.-born children live in mixed-status households that now live under chronic threat of family separation. One clinician stated, "Looking over my shoulder is a phrase that I hear often from patients. Even those who are citizens are scared they will be detained." The indiscriminate detention of Black and Brown community members, regardless of immigration status, threatens peace of mind, sense of security, and feelings of community belongingness, factors that we know are closely related to mental health. Collectively, we have seen heightened traumatic stress and anxiety, often exacerbating pre-existing mental health conditions. Clinicians report increasing rates of depression driven by social isolation and inability to leave home, experiences of discrimination, and perceived societal hatred. Here, a clinician shared about the symptoms that they are seeing. In session, children presented with hypervigilance and many reported nightmares, persistent worry about their parents' safety, and fears of being followed. One young migrant arrival talked to me about how they barricade their door after getting home safely for fear of ICE being outside. Another family talked about self-deporting with U.S. citizen children, saying, quote, "living in fear is not living," unquote. Others commented about the impact of mental health service utilization and changes in practice. She said, "I've had a high degree of no-shows and have had to convert complex, suicidal, traumatized patients to online modalities, which are less effective and take longer to establish rapport due to families' concerns about ICE being on the buses between clinic and home. We cannot do higher-level trauma work when we feel so unsafe, and this has derailed a lot of our treatments with youth already experiencing distress." We should not be asking parents to choose between risking their child committing suicide because they didn't get the mental health care that they needed, or risking detention and deportation because they did. As mental health providers, we cannot help people heal if they're living under constant threat and in survival mode. In sum, the long-term impacts of Midway Blitz cut across educational, public safety, and mental health domains. Immigration enforcement's infringement on the human rights of children and families is compromising mental health access at every level and causing a public mental health emergency. As a response, Chicago, as a welcoming city, mobilized telehealth expansion, food distribution, rapid response networks, and community education campaigns. However, there's more that we can do. First, we can end parent-child separation, pursue alternatives to detention, and protect the international human right to seek asylum. Second, we can reinstate sensitive locations protections and prohibit warrantless arrests. Third, we can fund access supports like transportation, telehealth, and home-based care. Fourth, we can expand legal and culturally responsive mental health services. And fifth, we can invest in workforce development for school personnel and community health workers. As I come to the end of my time today, I want to reiterate 3 points. We are not safer when children live in terror of losing their parents, when families are afraid to send their children to school or receive basic medical care. We are not safer when our neighbors are afraid to report crimes due to fear of law enforcement. And we are not safer when we criminalize migration, seeking safety, and family unity. I urge this commission to continue to shine a light on the harms of enforcement actions like Midway Blitz and bring our recommendations to state leaders to preserve the safety, health, and mental well-being of immigrant children and families. Thank you for your time and attention, and I'm happy to answer questions.
Thank you again, Dr. Ford-Paz. We're going to ask the questions after all three. So let me next ask Dr. Haverkamp to provide her testimony. Thank you.
Thank you for the opportunity to speak today. I'm a pediatrician speaking as the co-chair of the Refugee and Immigrant Child Health Initiative of the Illinois chapter of the American Academy of Pediatrics. For more than 3 decades, I've had the privilege of caring for refugee and immigrant children in the U.S., most recently and for the last 17 years in Illinois. In my ideal world, my patients or their parents would be here themselves to tell their own stories of the fear they experienced as part of Operation Midway Blitz, the harm it caused to them, and the ongoing manifestations of that stress in their lives. Unfortunately, in this less than ideal world, they're afraid of coming forward and being identified. I assure you that I asked their permission to share these stories. They beg for anonymity to avoid retribution or retaliation, but they are also anxious for their stories to be heard. They asked me to use my voice instead. I hope to honor them and the trust they place in me in this testimony. I omitted or slightly changed some details to assure privacy and confidentiality, but the events, timelines, and suffering are real. One afternoon, I saw a cheerful second grader with complex congenital cardiac disease. She has survived multiple open heart surgeries since shortly after birth. Just weeks earlier, I helped manage an unexpected and potentially life-threatening drop in her platelet count that led to uncontrolled bleeding and bruising. I was relieved to see her without bruises and smiling for her back-to-school physical. As I finished documenting her exam and her specialty follow-up appointments, her mother quietly told me that fear of immigration enforcement had led the girl's father to consider moving the family with all of their US-born children, including this patient, to his country of origin. The mother was terrified. In a rural area, in a resource-poor country, access to advanced medical care is limited. We had just seen how quickly her daughter could face a life-threatening complication. Moving could put her survival at risk. Then she whispered something else. Her daughter's occupational therapist had offered to become this girl's legal guardian so she could remain in the United States if her family left. The woman's husband berated her for considering leaving her daughter behind. She asked me what to do. Imagine that choice. Stay and defy your spouse, destroying your marriage, separate from one child to save her life, potentially leaving her feeling rejected or abandoned, or move with all your children and risk losing a daughter to lack of access to medical care if she gets sick. No parent should face that decision, but this sort of situation is what our Illinois families are contemplating out of fear. In October, the mother of 3 of my patients reached out to me. She knew people who had been detained and deported and was not sleeping or eating well because of anxiety. She was preparing temporary guardianship documents for her kids in case she and her husband were detained together, as many families were advised to do. Though they have extended family nearby, she felt no one else here would feel comfortable signing legal documents to present to authorities if needed to pick up her children. She asked if I would take on that responsibility. After discussing it with my husband, I agreed. I went to their apartment in Evanston, signed the paperwork, and walked her kindergartner to school so I would know what door to use if I needed to pick her up. When we arrived, her teacher showed no surprise and asked no questions, just hugged the girl and thanked me for making sure she got there safely. Days later, on Halloween, there was an incident near the school involving ICE and Border Patrol at the corner of Asbury and Oakton in Evanston. Officers deployed tear gas, brandished a gun, and threatened to shoot observers, and abducted at least 1 U.S. citizen. For a week afterward, this mother kept her oldest child home from school and moved the other 2 to a daycare closer to her. She was trying to reduce the radius of risk around her family. During this time, she requested a telehealth well child visit for her youngest because she was afraid to come to clinic. Obviously, I can't provide vaccines or draw routine screening labs via video, but I felt it was better to do something rather than defer the visit indefinitely. We identified a developmental delay in her child, and I referred her to early intervention, which the mother agreed to since the evaluation would be in her home. However, out of fear of coming to the clinic, she deferred recommended vaccines and labs for months. In late December, we finally got her child caught up. This girl did not contract a vaccine-preventable disease in the interim, and her labs were normal. But our vaccine schedules and screening timelines exist for a reason. They are designed to protect children and to protect communities. When families delay care out of fear, the risk extends beyond a single household. This mother was exceptionally proactive. I was persistent and perhaps overly engaged. Together, we eventually closed the gaps. But I don't know how many families simply stopped coming to see me and have not returned. Declining immunization rates threaten herd immunity. Missed developmental delays can affect a child's educational trajectory for life. Undetected anemia or lead exposure can cause lasting harm. In addition to the individual suffering, this ends up costing all our systems more. But families are not only avoiding primary care, they're avoiding specialists and delaying trips to hospitals. In the early fall, I received a refill request for an anti-seizure medication for a young man with complex medical needs, including epilepsy. This family has always been exceptionally adherent to care recommendations, so I called to ask why they needed me to refill the med. They reported that his neurologist required an in-person visit before renewing the prescription, and they were afraid to present to the hospital to see him because they had heard that people were being detained near there if they came for care. Though managing anti-seizure medications is outside my usual scope of practice, I refilled his prescription, understanding that their fear of detention could lead to uncontrolled seizures, again causing suffering for my individual patient and more costs for the healthcare system overall. Not long after, the young man's sister came to me in clinic. In high school, she had struggled with attention deficit disorder, anxiety, and an eating disorder. She had made great progress and had been living away at a 4-year college studying nursing. She changed her major and decided to attend a local community college this fall so she could be closer to her family. Her voice shaking, She reported that her father had been sitting in the family van, the one they used to transport her brother in his wheelchair, when immigration agents profiled him for the color of his skin. Witnesses told the family that agents broke the window and dragged him out, injuring him. The family did not know where he was for several days. Eventually, they found he had been transferred to detention out of state after refusing to sign deportation papers. Though he was part of the group identified as having been detained in violation of the Castañón-Nava consent decree and ordered released, he remained in detention out of state for months. While detained, he developed serious medical problems. The family feared he might lose a limb or die because he reported seeing that happen to others around him who didn't receive adequate care. My patient asked me for letters documenting her brother's complex medical needs, her own health history, and her younger sister's medical conditions to support efforts to secure her father's release. Over the months this father was in detention, my patient had a relapse of her eating disorder and lost 17 pounds. She struggled to focus, dropped a class, and developed suicidal ideation. Her brother became so anxious, he stopped leaving the house. He also begged his mother never to leave his sight. The youngest sister, who had been an excellent student, began refusing school. Her chronic pain syndrome returned, and she began self-harming by cutting her forearms. Eventually, their father was released close to midnight on a winter night with no advance notice. His daughter drove hours through the snow to retrieve him and took him directly to a hospital. He is now healing after IV antibiotics and surgery, but the psychological wounds for all of them remain. When I called last week to ask permission to share their story, their mother updated me about their ongoing issues. They jump at every knock at the door. Nightmares disrupt their sleep. The mother wakes with her heart racing, thinking she needs to find more people to write letters or her husband may never come home, even though he's lying beside her. Her son accompanies her and waits outside the door when she goes to the bathroom because he still fears having her out of his sight. Her husband cannot sleep with the lights on because the lights in detention were never turned off. He has flashbacks and intrusive thoughts about the suffering he saw and worries constantly about the people he met who are still detained. The girls continue to struggle despite therapy and medication. And they all have survivor's guilt, trapped between gratitude that they're together again and feeling that they can't celebrate because they know so many others whose loved ones are gone or still in detention. Even though this is a story with a relatively happy ending, the effects on each person in this household are profound and ongoing. And I'm just one pediatrician, sharing a few select anecdotes from my practice in Chicago during Operation Midway Blitz. My pediatric colleagues report the same patterns, with children missing care, parents living in constant fear, mental health crises escalating, schools absorbing trauma they did not create, and healthcare systems trying to compensate for damage done elsewhere. Fear has physiologic consequences. Chronic toxic stress increases risk of depression, cardiovascular disease, autoimmune illness, and shortens the lifespan. Providers throughout Illinois are now treating trauma layered onto medical issues in some of our most vulnerable populations. When you multiply the stories I've shared by thousands, the impact on clinics, hospitals, public health systems, and schools becomes profound. I commend legislative support for ongoing reimbursement for telehealth visits and beg for that to continue. That flexibility honed during the COVID epidemic allows us to reach some families who are too afraid to leave their homes. I urge expanded access to affordable, culturally responsive, comprehensive, trauma-informed mental health services for survivors of unjust detention and their families. And most importantly, I'd again like to thank my patients for trusting me to be a part of their lives and to share their stories. I hope I've honored that trust. Thank you for listening.
Dr. Vanderkamp, thank you so much. Now let me turn to the commissioners to see if they have any questions for the panel.
I want to thank you for appearing here, especially for the recommendations you're making, which will get serious consideration in terms of preparing our final report, which is due in a couple of months. But I want to see if you have any reaction to this. Aside from the very deep personal experience some of your patients have experienced, what is the impact of social media when I see children all the time being so good about accessing all kinds of visuals on their iPhones and in other methods? It seems to me that we now have an era where children are seeing people killed, shot, manhandled, tear gassed, that never existed before. What's the impact of all of that on mental health?
Thank you for the question. I think it's very relevant to what we're seeing. Children often can't differentiate between when they see these stories repeated on social media, they can't differentiate as to what happened previously and what is currently happening. So when they see these stories repeated, it's like they're happening again and again and again. Kids also don't have the mental filter that adults do to know that enough is enough, I'm going to take a break from this. So one of the recommendations we are making time and time again with our families is step away from social media, make sure that you're engaging in good self-care, you're exercising, you're eating nutritious food, you're drinking water, you're seeing people in real life, and that you're not, to use a kid's word, doom scrolling all day and immersing yourself in this, because we know that once you watch the video, the algorithms will give you more and more of the same, and kids will interpret that as it is continuing to happen all day, every day. And while that is not entirely true, we want kids to step away and know that there are people still fighting for immigrant and refugee rights, that there are people in rapid response networks trying to counteract what's happening. There are legislators and lawyers doing work actively, and that's the narrative that we're trying to promote, that yes, there are dangers we need to consider. We need to be prepared, family preparedness planning, know your rights, and we also need to be taking care of our mental health and doing things that keep us healthy.
I have a question. Oh, actually, thank you so much for being here, and thank you for all that you do. You provide the support network where many of us would probably not have that ability to do, and children particularly. I guess my question is, it's not just the impact, the mental health for children and their families, but I think it's also important to know what is the mental health state for the providers, for you guys, because you have to be healthy to provide the support and network for the patients. And, you know, do you fear being, having reprisal? Do you fear that something's going to come to you as a result of Operation Midway Blitz? Dr. Vandenkamp, I mean, you taking on the guardianship of children, I mean, you know, that is amazing, and but not everyone's able to do that.
Nor should they. I recognize that that's a bit exceptional, but I had that memory of the other mother speaking to me about how knowing that that occupational therapist had offered that put her in a difficult position, but also was so reassuring to her to know that there were people who were caring that deeply, that I felt called when asked to respond to that. And sure, I feel anxious at times about calling attention to myself, my family, the work that I do for speaking out. And at the same time, when I hear the stories that my patients tell me, I recognize the tremendous privilege that I have in that it's not my day-to-day reality. I don't worry about ICE knocking on my door. I worry about them knocking on my patients' doors. But as Dr. Geary mentioned, we took an oath, and I take that oath seriously.
Good morning. I want to piggyback and thank you guys for your courage in coming to testify us today and sharing your stories. They're really gut-wrenching and heartbreaking and I'm sure these are just snapshots of what you endure each day. But my question is more to future behavior. I know you specialize in pediatrics, but when children endure trauma like this, the ones that experience the traumas you've described, how do they play out in their adult lives? should we expect to see more violent behavior or just deviant behavior? What can we expect in the future after, say, 10 years from now from these children?
Thank you for that question. There is no equifinality in where kids end up after they've experienced trauma because there are so many factors that we have to consider as they grow up. Yes, they'll be more at risk for mental health issues, whether that's depression or anxiety or psychotic disorders developing without any intervention, without any treatment. But I want to emphasize that kids' brains are plastic and resilient and can form new neuronal connections that are very important, and that there's so much that we as a community and schools and doctors can do to intervene and mitigate the risks that they've been exposed to. So when kids are exposed to violence, there is a risk that they may, demonstrate that violence and have reactive aggression or behavioral problems or relationship problems. But when we provide the appropriate social emotional supports, when we provide mental health interventions, when we provide mentorship programs and after school activities that help them develop leadership qualities or social problem solving skills, we are reteaching them how to interact, when we can actually create a corrective intervention so that they don't necessarily end up with mental health issues. They don't necessarily develop more aggression in the future. So there is no final endpoint if they're exposed to violence. There's so many things that we can do to intervene.
And I just want to add, the number one thing we can do to buffer children against this type of toxic stress is to maintain that healthy caregiver attachment and that person who walks through the experiences with them, who navigates, who mitigates, who supports. And that is why we should not be separating these families. That is the one thing that we are doing to further harm them currently.
Yep. One last question.
I'm not sure if this is actually a question or just a request or comment. One of the things we've seen, thank you so much for your testimony, by the way, and to hear the concrete details of what happens to individuals, I think provides us a bridge to empathy that is what we're trying to spread across the society and not just the and alleviating the invisibility of what you're talking about. So my comment or question is, one of the things we've seen recently, which is a small note of optimism, and I'm wondering if this filters through to your patients, is the numbers of young people who are getting out there and walking out of school and demonstrating and trying to show and model that we have positive resistance to these phenomena. Have any of your patients or their parents reflected on this to you? Is this out there in the communities that you serve that this is happening?
Absolutely. I think we think of civic engagement and involvement in activism as one of the healthy ways to problem solve in the current climate that we're living in, as long as people feel safe in doing so. I think there's many of my colleagues who would have liked to be here today but didn't feel safe in doing so. And I think likewise, families and children have different levels of comfort in getting involved with civic engagement and walkouts and activism, things like that. But there are even things behind the scenes that people can be doing. They could be stuffing envelopes or creating signage and things like that. And they don't need to be the frontline person. But I think even contributing gives a sense of agency and also a sense of solidarity that they're not in this alone. So they find like-minded people with whom they can share their lives.
I would say the antidote to moral distress is action and community. And that's why it's just wonderful to be here today. So thank you.
Yeah, thank you very much. And I apologize that we have such limited time, and I spent a lot of it with my opening statements, and so we will make up some of it during our break. We have a 10-minute scheduled break. We'll make it 5 so that we could make sure that all the panelists have the right time. I did have one question, and it's, both Dr. Geary and Dr. Vanderkamp said that both the clinical professionals and the clients were afraid to testify. And I would, given this panel, we're seeking accountability here, you just tell a little bit. I think we assume it's obvious why they're afraid, but what's at the core of the clinicians, the doctors, the hospitals, and the clients being afraid to testify at a commission like this?
So the clinicians are afraid of reprisals from their employers and not feeling comfortable speaking out that it might risk their job.
Thank you.
And I think the employers are concerned that having representatives from their institutions speaking will lead to attention, potential funding cuts, and a decrease in their ability to serve their patients.
I really appreciate it. I think this is really important for the record that we take that into account. So I want to thank you all for your wonderful testimony. It's very important. As the chairman said, all your recommendations go into the record, and we appreciate your time. Thank you. Now let us prepare for the next panel. So as the next panelists come up, I'll just read a little bit about what you're about to hear. So it's on education, youth stability. So first, let me thank our panelists in grounding us in the health impacts. We heard how instability affects children's bodies and minds. We heard how fear can disrupt routines, delay care, create lasting stress. We've heard how people die alone. We now turn to another core institution in any safe community, and that's our schools. If communities were made safer, we would expect schools to be more stable, not more fragile. We would expect attendance to hold steady. We would expect family engagement to remain strong. We would expect children to feel secure enough to focus and to learn. Instead, educators, youth-serving organizations begin observing shifts in engagement, in participation, in emotional regulation, and in the trust. Schools are among the most trusted institutions in neighborhood. When families pull back from schools, it tells us something profound about the broader climate. This panel helps us continue testing the claim of safety. Did enforcement action create conditions for young people to thrive, or did they introduce new barriers to stability and opportunity? The answers matter not only for today, but for the long trajectory of children and communities across Illinois. So joining us today are Mariana Soto-Manning. She is an expert in research, long-term educational and researches long-term educational impacts. Juliet de Jesus Alejandre, who is expert in neighborhood and family engagement, and Seth Levin, who works on school routines, attendance, and will testify on student engagement. So I want to thank all three of you for joining us today, and we're taking all this into the record, and we will take your comments, and it'll help us guide our decisions and our recommendations to come. So why don't we begin with Mariana Soto-Manning.
Thank you. Thank you for seeking accountability. My name is Mariana Soto-Manning. I serve as president of Erickson Institute, a graduate institution devoted exclusively to child development, early childhood education, early intervention, child and family mental health. I'm a scholar of belonging, of institutional power, racialization, and justice in early childhood systems. I'm here before you today, grounded in developmental neuroscience, professional ethics, constitutional principles, economic evidence, and internationally recognized children's rights principles. What has occurred in Operation Midway Blitz during the recent enforcement actions conducted by the U.S. Immigration and Customs Enforcement is not simply policy implementation. It is developmental harm, it is ethical breach, it is constitutional instability, it is a violation of children's rights. And the consequences, neurologic, psychological, civic, and economic, will outlast this moment if we fail to act. I'll start by talking about the developing brain that cannot be exempted from policy consequences. Early childhood is the most neurologically sensitive period of human development. Neuroarchitecture forms rapidly. The stress response system calibrates in response to environmental cues. So attachment bonds establish whether the world feels safe or dangerous. The science is settled. When children experience stable, predictable, responsive caregiving, their brains wire for learning, for empathy, for self-regulation, and long-term resilience. When children experience chronic threat, particularly threat tied to caregiver safety, their brains wire for vigilance. Cortisol levels elevate chronically. Executive function weakens. Working memory deteriorates. Sleep fragments. Emotional regulation destabilizes. Children here have witnessed arrests near homes. They have heard helicopters overhead. They have seen neighbors detained. They have absorbed adult fear. They have missed school because their families fear exposure. The developing brain doesn't categorize these activities as immigration enforcement. It encodes them as threat. When threat becomes ambient, development shifts from growth to survival. This is predictable. And when harm is predictable, proceeding without mitigation becomes indefensible. I also want to talk about the right to family integrity that has been compromised. A child's most fundamental right is the right to family stability. Attachment is not just an abstract theory. It is the organizing principle of early childhood development. Secure attachment teaches a child that distress will be met with protection. When enforcement actions create visible and repeated risk of caregiver removal, the attachment system is violently activated. Even if separation does not ultimately occur, the sustained possibility destabilizes a child's internal world. Clinically, we see night terrors, we see regression in toileting, panic-driven clinginess, aggression, withdrawal, reenactments of raids in classroom play, all of which have been reported by people who did not feel safe to be here today. Young children cannot debate statutes. They ask one question: will my parent come back? Will my family member come back? To create a policy environment where the question becomes common in early childhood is not neutral governance. It is a breach of children's rights to family integrity. I want to share with you the detention of a U.S. citizen clinician, which was constitution and developmental alarm. An Erickson clinician, Illinois-born, United States citizen, providing trauma-informed mental health services to children in Little Village, was detained during enforcement activity. Not undocumented, not charged, a citizen. From a constitutional standpoint, detention of a citizen without cause raises grave due process concerns. From a developmental standpoint, the impact is devastating. Children who relied on this clinician for regulation and healing witnessed the helper detained. The message transmitted to developing neural system is catastrophic. No one is safe, not even the adults who are supposed to protect you. Therapeutic trust fractures, institutional credibility erodes, healing infrastructures collapse. This incident is not anecdotal, it's diagnostic. It reveals enforcement practices broad enough to stabilize both constitutional safeguards and children's emotional security simultaneously. And this is not the only incident that happened linked to our institution. But people are afraid to put those around them in harm's way. What we know from the National Association for the Education of Young Children and its Code of Ethical Conduct is unequivocal. The first principle of the Code of Ethics states, above all, we shall not harm children. And that includes psychological, emotional harm. The code requires early childhood professionals to protect children from psychological harm, create environments of safety and trust, respect family integrity, and honor the dignity of every child. But how? How are professionals able to uphold their code of ethics in this current environment? When public enforcement strategies generate foreseeable psychological distress for children, the ethical foundation of our field is undermined, is ignored. Educators in Little Village are working tirelessly to buffer children from fear. But we cannot ask teachers to create islands of safety while policy floods the surrounding environment with threat. When parents don't feel safe taking their children to school, to childcare, professional ethics demand coherence between public systems and child well-being. And right now, that coherence is being fractured. The United Nations Convention on the Rights of the Child establishes global standard for children's rights. Article 3 states the best interests of a child shall be the primary consideration. Article 9, children have the right to family unit. Article 19, protection from mental violence. Article 28, the right to education. Although the United States remains the only country in the world not to have ratified the convention, these principles really represent internationally recognized norms for children's rights as human rights. When enforcement strategies create foreseeable fear, destabilize family integrity, interfere with school attendance, and produce measurable psychological harm, they conflict with the spirit and substance of children's rights as human rights, as widely agreed upon. The best interests of the child cannot be rhetorical. If children's neurological stability is sacrificed to enforcement visibility, their best interests are not primary. They are subordinated. And we need to also make sure that we are keeping accountable the racialized suspicion that we all are witnessing right now. I am Latina, I'm a US citizen, I'm the president of a graduate institution. I have begun carrying my passport with me at all times, not for travel, not for protection. Too many Latinos, citizens included, have been questioned, stopped, and treated as presumptively suspect. When a citizen who is a university president feels compelled to carry proof of her belonging in her own city, equal protection concerns are not abstract. Children observe this vigilance. They learn that identity must be documented defensively, that some people belong where others are always having their belonging questioned. They learn that identity must be separate from belonging, even if they feel that belonging. And they're told again and again, you don't belong here. Your family doesn't belong here. Your family is lesser than. They learn that belonging is conditional. Racialized suspicion imprints early. It becomes part of identity formation in young children. That imprint is psychological harm in effect. So the long-term cost to society, the consequences of early childhood trauma are not contained to childhood, and I know that Commissioner Sam has asked about that. Chronic early stress predicts, without intervention, increased mental health disorders, greater reliance on public health systems, lower academic achievement and attainment, reduced lifetime earnings, higher rates of civic disengagement, and increased involvement with juvenile justice systems. Economists consistently demonstrate that early adversity compounds across decades without the proper support. When policy generates community-wide stress, we incur long-term public costs. There are higher healthcare expenditures, there are greater educational remediation costs, reduced workforce productivity, and weakened civic trust. The question is not whether there will be costs. The question is whether we choose to incur it. Investing in child stability produces returns. Destabilizing early development produces liabilities, and we are currently accruing liabilities. We can't claim to value children while tolerating policies that activate their stress systems daily and many times, multiple times a day. We cannot champion early literacy while frightening children away from school. We cannot celebrate therapeutic services while detaining clinicians. We cannot speak of equal protection while racialized suspicion expands and is broadly ignored. We cannot invoke family values while destabilizing families. The developmental science is clear. The ethical obligations are clear. The constitutional principles are clear. The international human rights standards are clear. When all four converge and signal harm, continuing unchanged is not neutrality, it is disregard. In closing, early childhood does not wait for compromise. Neuropaths form today. Stress systems calibrate today. Attachment bonds strengthen or fracture today. Early morning, every morning that children in Little Village in Chicago wake up uncertain about caregiver safety, their bodies adapt toward vigilance. Every time my peers, trust erodes. Every missed day of school compounds development loss. Did not design those policies. Absorbing their costs neurologically, psychologically, and relationally. If we know the harm, and we do, then we are responsible for preventing it. History will not measure us by enforcement metrics. It will measure us by whether we protect children when we had the knowledge to do so. The rights of children have been compromised, and it is within our power and the power of this commission and our obligation to restore alignment between policy and child well-being. Thank you.
Thank you so much, President Soto Manning, for your leadership at Erickson Institute and for your testimony today. Now let me turn it over to Julieta de Jesus Alejandre, who's the Executive Director of Palenque LSNA, a cornerstone organization in Logan Square and beyond.
All right, good morning. Thank you to the people of Illinois who have been good neighbors and have come outside to blow whistles and document the dangerous behavior of masked men. And thank you to all the brave people showing up today to provide testimony and to the organizers of today's commission. I am the Executive Director of Palenque LSNA, a community-based organization that builds power with immigrant Black and brown mothers and youth on the northwest side of Chicago for the last 64 years. Palenque LSNA is also a proud member of the Illinois Coalition for the Immigrant and Refugee Rights and the Illinois Access to Justice Network. One can look at the so-called achievement gaps between students of color and their white peers that have persisted for decades to know that schools have long been a site for structural violence for Black, Latino, and working class students in cities like Chicago. Let's be clear that the federal government is blazingly attacking sanctuary cities today, like Chicago, Minneapolis, Los Angeles, but it has long been responsible for creating policies that hurt urban centers by redlining and investing in the economic and racial segregation of our communities before and since schools were ordered to be desegregated in the 1950s. So it's within that commitment to economic and social inequality that generations of education organizers, parents, and educators have brought love and innovation for teaching and learning that our children deserve. For over 30 years, Palenque LSNA has built an entire ecosystem of work based on the belief that schools are the centers of community life, that they must gorgeously reflect our collective resilience and intelligence, and that they belong to all of us equally, no matter what. From that premise in 1995, Palenque LSNA, then the Logan Square Neighborhood Association, hired our first group of parent mentors at Funston School on the corners of Armitage and Central Park. It was here at Funston where Tammy Love and other Black and Latina mothers were trained to be community organizers and tutors to transform this and other underfunded neighborhood schools into vital cultural centers where children receive both love and help with reading and math during the day and enrichment activities like Mexican folkloric dance and hip hop in the evenings. Eventually, these mothers would help create the community learning centers at Funston and other schools across the community where neighbors can take English and JD classes. Within a few more years, more parents in Hermosa and Logan Square schools organized to create the program that would become the Grow Your Own Teachers Illinois program that brought the university to their barrio. And the next steps to their commitment to transform these schools into our schools. The transformation has been powerful. The Parent Mentor Program has grown from a dozen moms in one school in 1995 to now over 2,000 mothers across the state, working with close to 50 community-based organizations that are experts in turning loving mothers into fierce education justice advocates who make their schools safe and loving places across 43 districts, serving 42,000 students every day in classrooms across the state. In 2005, Palenque won the Ford Foundation's National Leadership for a Changing World Award, and the foundation supported Chicago Community Organizing Award for its innovative and transformative for transforming low-income neighborhood schools. Our education work has been recognized by Illinois Governor's Office, the U.S. Department of Education, and national grant makers that were looking for models for immigrant integration and madre-led schools transformation. Let me be clear that mothers organizing with Palenque in their schools are leaders shaping their own destinies. So it was again in 2016, after the first Trump election, that Palenque mothers held a press conference outside of Funston Elementary School, where it all started, and declared their schools and all Chicago public schools to be sanctuaries for all families, no matter their immigration status. Their declaration was a catalyst for a decades-long campaign that continues to today. So last fall, once again at Funston, at the corner of Armitage and Central Park in Logan Square, Funston became the site of another first, making it the first time tear gas was discharged in the city of Chicago. This happened on a school day while kindergartners and first graders were outside on recess on a sunny and warm day, causing panic and horror. One Funston teacher said about that day, "The presence of federal agents outside was the most dangerous day my students have ever faced at school. Federal agents trained to escalate and provoke violence against everyday neighbors in the guise of enforcing civil immigration matters only make our communities and schools exponentially less safe." The incident at Funston may have been the first, but an investigation by a coalition of Chicago area newsrooms and independent journalists determined that federal agents have deployed chemical weapons against bystanders, AKA neighbors, at least 49 times across 18 separate incidents in Chicago and its suburbs during Operation Midway Blitz, several of those happening near schools. What impact does this all have? Well, Palenque has intentionally worked with tens of thousands of mothers over the last 30 years to build systems of care and safety through innovative mother-led solutions. And Midway Blitz and everything that we've seen in Minneapolis leaves us all less safe. Everyone is less safe. Children miss schools when parents are threatened with violence and separation. One extremely frightened father in my neighborhood could not bring himself to allow his freshman son enrolled at our local high school to attend school for almost the entire period of the Midway Blitz operation. According to an analysis of Chalkbeat, attendance rates dropped to as low as 78% after immigration sweeps in Chicago became public. Even when attending school, fear and anxiety clouded up precious brain cells, making it difficult for children to learn. One Northwest Side teacher said, "Focus is affected, and there are more complaints about tummy aches and headaches, and the energy is just so down." Older students in my community, those in middle school and high school, are often parentified when parents are unable to take care of their usual adult responsibilities because they're being detained or they're trying to avoid being taken away from their children. This summer, high school students in our youth summer jobs often gave each other shopping tips for buying groceries for their families. In one conversation, a youth leader pulled up pictures on her phone to help other students distinguish between parsley and cilantro when buying food for their families. While these young people demonstrate enormous strength and courage, parentification of children is also associated with higher levels of risky behaviors as young people seek less than healthy coping mechanisms to deal with the enormous pressure to take care of their families. Caregivers grapple with guilt and other mental health pressures as they also do not wish to place these burdens on their children's shoulders, but have little other choice. When one mother, a community leader, during the Operation Midway Blitz, had to depend on her 13-year-old daughter to walk her toddler sibling to his developmental therapy sessions to support his new autism diagnosis a few times a week. I can only imagine that she could not fully exhale until both of her babies made it home each time. Our people are resilient, but they should not have to be so resilient. School ecosystems are also resilient. While our reliance on the usual systems of care have eroded, new systems emerge. Migra Watch school patrols were born at Funston too. Since the day of the tear gas incident, hundreds of neighbors for months have armed themselves with whistles and signal chats across the Northwest Side, being sources of community love and protection on corners. While our trust in the federal government to provide any care or support for our families is at an all-time low, our trust and belief in our neighbors is at an all-time high. I fear the kind of future this federal administration wants. It's one where children like ours no longer live here in the U.S. And again, for 30 years, we've been a part of an ecosystem of people organizing with our neighbors and mothers for better schools. Because, frankly, our federal government and our city and state governments have refused to invest equitably and adequately in poor children of color in our city. Today, we're here because now the federal government is kidnapping our people, and community, like always, will stand in their way. Who do we want to become through all of this federal violence? How is the state, like so many of us in community, further investing in systems of care? For instance, one thing the state can do this session is pay for more social workers for school communities that have been impacted harshly by federal administration's policies and didn't have enough counselors or social workers to begin with. HB 5553 was introduced into the House in Springfield and could make Illinois the first state to ban tear gas. That's a minimum. What more can the state of Illinois do to protect our children from the structural, psychological, and physical violence of this federal government? How will we hold these agents accountable for the violations around sanctuary schools that our mothers declared 10 years ago? Thank you for your time.
Thank you for your time, Juliet, and we will have questions at the end of the testimony. So next, we have the principal of Brentano Method Science Academy, Seth Lavin.
Thank you for having me here. My name is Seth Lavin. I am the principal of Brentano School in Logan Square. We serve preschool to 8th grade. Our school is diverse, but our biggest group of students is Latino students. For months this fall, like all schools in Chicago, our students and their parents were under attack. Our teachers stood in classrooms where children were absent for weeks. We shifted operations, we canceled events, we changed how we exist. Operation Midway Blitz hurt children. It hurt families, and the damage that it did will take years to understand. This week I asked a preschool teacher, "How are you?" And she said, "Hopeful." She said, "When I look at my students, 3- and 4-year-olds, naming letters, sitting at the carpet, I think maybe by the time you're grown up, we'll have made things better." These agents came to our city in masks and in trucks with dark windows. They took mothers and fathers, they separated families, they tear-gassed neighborhoods. They killed a man and shot a woman. There is no solution for that, but this commission's work is an answer and a path to make things better. So thank you for it. Since September, agents arrested more than 4,000 people in Chicago and surrounding towns. 1 in 5 Chicagoans is an immigrant. 1 in 12 Chicago households includes someone undocumented. Trump officials said they targeted violent criminals who make us unsafe. They hope that we picture dark strangers who put others in dangers, but they're talking about our students and their parents, people who walk their children to school. You can't call an operation targeted or a sting or a sweep when it blankets a city in fear. Agents picked up people with no criminal records, with asylum cases and legal work status. They took children, like an 8-year-old girl from the school next to ours. They detained U.S. citizens, like the high school-age son of a parent at my school, a parent mentor, who got that news, that her son, a child, a U.S. citizen, had been violently arrested by federal agents while she was standing in a classroom at our school, volunteering with children. A third grader at my school stopped eating lunch. His teacher noticed and said, "What's happening?" He said, "Well, I don't want to type in my lunch code at the machine at the end of the lunch line," because he was afraid that if he did, in his third grade mind, ICE would know where he was or his family. Working in schools means existing in contradiction. Children are resilient, but also they remember. In our student newspaper, a girl, an immigrant, wrote in Spanish, "Immigration officers are now everywhere." She said, "We don't even want to leave our homes anymore." She said, "Parents are taken from their jobs. Their families don't even know and worry about them. They can't even send a message." A mom, a parent mentor, told us that her son had begun barricading the doors of his bedroom with furniture because he was terrified agents might come at night. And these were students who came to school. Thousands stayed home, and we know from COVID how much harm that does to them. Agents drove through our city every day, stopping people on the street. You could try to tell a child who's afraid to come to school, it's just specific targeted people, but we know that wasn't true. You could say they won't come after grandparents or kids or people dropping children off at school, but they did. So what do you tell a mother who's afraid to step onto the sidewalk? What do you tell somebody who holds their breath each time a car turns down the street? What does it feel like for your child to ask who cares for them if you are taken? We had parents so afraid to leave their home they stopped buying groceries. We had children begging their parents in the morning, "Don't leave for work," because they were afraid that at night their parents wouldn't be there. We had parents who filled out temporary guardianship forms, like we heard about earlier on the panel, because those parents were terrified that if they dropped their children off at school in the morning and then were taken, their children would exit our schools in the afternoon and have no one there to pick them up. We saw parents who that happened to, like a dad from a school in my neighborhood picked up at a CTA bus stop on his way home from his kid's school. I spoke to a mom in November in the hallway. I asked her, "How are you?" And her eyes just filled with tears. She said, "I'm just so scared." Schools are supposed to be safe places for children. On Halloween, I walked into a class where the teacher was dressed as a Teletubby. She was reading to her students from A Telltale Heart. This winter, our boys' basketball team won its first game in 2 years. The kids celebrated. That's what's supposed to happen in schools. That's what we're here to do. But for months this year, for children all across the city and the region, and I want to be clear on this, there are schools where this happened to 80% of children, and there are schools where it happened to 10 children. But in every school in this city, that happened. And what happened was that those things didn't, that those experiences didn't occur. At one school, ICE agents crossed into a schoolyard in the middle of the day to take a landscaper from CPS property. At another school, agents detained a crossing guard. This is a Chicago woman, not a visible immigrant to ICE, because they suspected her of tipping off a Latino family that ICE was near. The school next to ours went into lockdown repeatedly because of ICE trucks. We've heard about tear gas on the street. At another school also next to us, the school canceled its Hispanic Heritage Assembly. Children dressed up to perform for one another in October canceled because there was ICE activity and tear gas on the street outside. People in schools, as you've heard, did amazing, heroic things. They created walking school buses to keep kids safe. They organized grocery caravans. They called legal clinics to help families whose loved ones were taken get representation. Those actions were inspirational and made enormous difference. And it feels good to hear those stories, but difference-making though they are, you cannot feel good in this moment. You cannot tell a child it's okay when it isn't and when it won't be. What you say to a child is, "This is awful." What you say is, "I'm sorry." And what you say is, "We are going to try to make things better." Midway Blitz was not a crackdown or a sweep or a sting. It was an attack. It was a fist thrown out, a beating. That's what we took. Chicago took, our families and our children's took a beating. And they're still here. And Chicago is still here. And the people who care for them are still here. But we can't pretend that's not what occurred. To this body for recording the truth of that, and to everyone trying to make things better, to create a better world for those preschoolers to grow up in. Thank you.
Thank you, Principal Lavin. Let me turn to the panel. I have some questions.
First of all, thank you all for coming today and sharing your stories and the stories of the folks in your community. There's some reporting that Midway Blitz, or at least ICE and CBP, may be coming back in March or April of this year. One, I'm wondering if the folks in your community are aware of that, and then two, if there are any steps that you all or your organizations are taking to help prepare them for that possibility.
Yes, we're very much aware of it. We've spent the last 2 months of relative, right, rest. One, looking at in horror and also awe of what's happening in Minneapolis. Learning from the tactics that we see there, both by the federal agents and also by community. What we all in the community defense community see is that it's not enough just to have a rapid response network, that everyone actually needs to be ready and prepared. And so what does it look like for every neighbor, every block, right, to have neighbors who know what to do, who to call, who are the most vulnerable, who has privilege to come out. And so there's a lot of efforts to just empower and give neighbors permission, right, to talk to each other. And tools that are being created, whistle packets, different zines, how do you organize your block, and continue training on know your rights, continue training on the newest tactics, and also just encouragement for people to take up space with joy. Like one of the things that we say a lot in all of our trainings is that you cannot oppress a joyful people. And we create joy by celebrating what makes us human, right? And eating together and seeing our children play and go to the basketball games. Way to go, right? And those connections will make us safer. So that's kind of where we're at, and obviously learning from communications networks and really connecting the dots between the personal pain that we see happening and also the billionaires. Who are responsible, who are getting rich off of our pain. So how do we hold them accountable and their business accountable and expose their ties to government contracts, expose how they are profiting off of our people's pain so that we can end it and we can take the power that we actually have. We are the majority. There are more good people who don't want any of this to happen than there are those who are gaining wealth from it.
First, thank you so much for your testimony today. It was incredibly moving and compelling, and so I thank you for being present. I took away from what you were sharing today about the sense of identity being separate from belonging and belonging being conditional, and that I was also very moved by the fact that Heritage Month activity had to be canceled. So as a child of immigrants, I understand how hard it is to feel belonging in this country, but I have not experienced the psychological harm or the physical harm that we have under Operation Midway Blitz. As a commission, we are trying to figure out what best policy recommendations we should set forth in our report. And so as you think about how do we create a new sense of belonging for the children and youth who have been affected in so many ways, what would you recommend to us as the next steps? Because this will end, and we must be prepared for the next steps, because I can't imagine living in Illinois where children of all backgrounds do not feel like they belong.
I'll get started and, of course, turn over. I think that part of the issue related to belonging is that there's an ascription of belonging, who belongs and who does not. And one of the things that we were experiencing before these major actions was that there was a movement toward children seeing themselves in their teachers, children seeing themselves in medical professionals and social workers, and all of those quote-unquote diversity initiatives or justice initiatives are being attacked. So the more that children do not see themselves, they are not going to see themselves belonging in professions that they are not overrepresented in. That's the first thing. The second thing is when they do not see belonging, there are two pathways. They can either assimilate and try to become someone else, which causes harm, or they can negate their roots and themselves and start engaging in societally imposed self-hate, which is trauma, which is long-term, both of which are really harmful. And so part of it is for the children, for teachers, we're expecting them to put on a mask and perform as if things were okay. We are really going to have to attend to the stress, mental health, quality of life, sleep, of professionals working with children, because as we know in education, the number one factor in terms of young children's success has to do, and mental health, has to do with the quality of mental health of the teacher, because that interaction is going to be mediated by that. And so how is it that we put in place the supports needed to heal professionals who are working with children? And how is it that we create the environment where children can see themselves and be proud of themselves instead of trying to not speak Spanish? I'll just share one quick story of a parent who decided that the child was not going to be called Luis anymore. That child became Louis. And that child was forbidden from speaking Spanish so that he would not be profiled. Of course, that didn't protect the child, but it created the level of trauma that we need to undo. So this lack of belonging that has been propagated by the Operation Midway Blitz and associated actions have created needs for us to really heal and affirm community.
I agree completely. It's a great question. Your points are excellent. We absolutely see it as well. People who are taking Mexican flags down from pins on their backpacks, not speaking Spanish, changing how they present themselves at school because their parents are saying, do not draw attention to the fact that you are from an immigrant family. Do not draw attention to the fact that you are Latino or Muslim or from Africa. That is unacceptable and it is wrong. And I completely agree with you. One of the most extraordinary things that the Palenque organization does in our neighborhood is make real the Grow Your Own teacher movement. And the state has a key role in investing in programs like those at Palenque and Erickson that support individuals in becoming bilingual educators, bilingual school staff members, parent mentors. And so creating infrastructure that ensures that people who are immigrants are not just welcome in Chicago, but that Chicago and Illinois and the region have invested in infrastructure to ensure that the children who are children of immigrants or immigrants themselves have people who look like them and support them and affirm them in those spaces is a key role of the state. And so the answer is to invest in those things and redouble those investments.
Commissioner Austriaco?
Yeah, thank you so much for all that you do. Really, really appreciate it. You mentioned the school is the center of community life, which it is. It's a safe haven. It should be, a place that children can really grow and be themselves. What would you recommend? You may mention about the infrastructure, state spending for the infrastructure. You also mentioned about state paying for social workers, counselors in school. What other recommendations would you have to ensure that the school remain the center of community life?
I think one of the catch-22s we find ourselves in is that we live in a state that's actually doing a pretty good job at passing laws, right, that protect our people. However, where's enforcement? Where are the consequences for that? Until an individual ICE agent or federal agent is individually held accountable for taking someone's life, they will continue to act as if it doesn't matter because that is the message that they're getting over and over again. What would it look like to one, enforce what's already on the books, but also heighten, I think back, I grew up in Chicago in the 90s, that if you sold a little bit of weed by a school, it had a heftier penalty, right? A little bit of weed. Well, what do you get for throwing tear gas by a school? What heavier penalty is there for that? For these federal agents, right now, they're getting nothing. And so if we're going to call them sanctuaries, and they are, how do we really send that message? And it's going to be through enforcement. And so getting the Illinois State Police, CPD, to really be able to do that, it's not my job. How do we do that collectively?
I will add that one of the things that we have to deal with is the debt that's being mounted in this crime against humanity. And so part of that is historically, there has been the marginalization, erasure. We need to deal with these as really another parcel of this historical debt. Economically, what are the losses that need to be made up? In terms of civic engagement and exclusion, who gets to vote and who doesn't and why? What are some of the ways that we can really make sure that immigrant communities that have been targeted are centered in terms of the decision-making and doing what's right? Like the same way that schooling has changed, the education of teachers, social workers at Erickson has changed. We had people who wanted to drop out or were being pushed out because they were afraid that members of their families, if they were in mixed documentation families, would be targeted. So what is it that we are doing to pay back the disruption, the interruption, the harm and the debt that is being caused in the profession? We know that teaching remains over 80% white. We know that our children are overwhelmingly Black and brown, and if they don't see themselves, they're not going to feel the level of belonging that will be affirmative to their identities. And this makes it even more urgent, especially during a time in which all diversity, equity, inclusion language, movements, legislation, investments are being dismantled.
Thank you for your testimony. So Principal Lavin, Director de Jesus Alejandre, and President Sauto Manning, I want to thank you each for your testimony. And please don't stop here. We are not finished with this report. We have a couple of more months. So if you have input, please send it in. Our way to do that is online, and you'll have access to it. So again, I want to thank you. At this point, we're going to take a 5-minute recess, and we'll be back for the panel on safety. Thank you again. Well, welcome back, everyone. For the interest of time, we're going to get this started again as we all find our seats. Before the break, we examined the health systems and school communities. We heard how fear affected well-being. We heard how instability entered classrooms. We now turn directly to the heart of today's title, public safety itself. These operations were explicitly framed as efforts to protect residents and reduce crime. Arrest numbers were represented as evidence of success. But safety is not measured in arrest alone. It is measured in trust. It is measured in whether neighbors can call 911 when they need help. It is measured in cooperation, engagement, and shared responsibility for community well-being. Today's panel examines how law enforcement operations affected families' access to care, starting our work to test the federal claim that these actions make communities safer. If safety were strengthened, we would expect stability in daily life. Residents and families able to access healthcare services reliably, continuity in care and preventive services. Well, I'm sorry about that. I moved to the wrong page. If fear causes residents to withdraw from public systems, including law enforcement and violence prevention efforts, then we must ask whether safety was strengthened or weakened. This panel will go directly to the central question of this hearing. Did what was described as safety function in practice as stability, or did it function as disruption? Public safety depends on trust, and trust, once fractured, is not easily restored. Today we have a respected panel, including Dr. Catherine Bocanegra, who's a PhD in LCSW and is assistant professor at Jane Addams College of Social Work. We have Deputy Mayor for Community Safety for the City of Chicago, Gary Ann Gatewood, and Dominique McCord, who is at LCSW, and she's the Chief Program Officer for the Metropolitan Peace Initiatives. We're going to begin today with Dr. Catherine Bocanegra.
Excellent. Okay, there we go. Awkward camera angle. All right, good morning. I'll be using some slides, and I'd first like to extend a note of gratitude to Governor Pritzker for the assembling of the Illinois Accountability Commission and for the appointment of Executive Director Hina Mahmoud at its helm. The purpose of this commission is timely and urgent, and he could not have appointed a more brilliant leader, and I want to thank also each of the commissioners for your public service and your time on this. I'm thankful to open this panel focusing on public safety. After me, you will hear, you can go back to the intros, okay, from two experts and leaders on community safety. As a researcher, I will frame my brief presentation on the definition of safety and the best evidence we have of what generates holistic safety for the most people. The enhancement and expansion of federal immigration enforcement in Illinois and in many other states has been conducted both under the aims of improving safety and in the names of victims of violence. I will interrogate these claims today, not to debate the importance of safety, but to evaluate whether the strategies used in its name align with what the research shows reduces harm over time. On to the next slide. I have been working as a social worker in the state of Illinois for nearly 20 years in the areas of community mental health and community violence intervention, and I've been working with families of homicide victims for over 15 years. I'm an assistant professor at the University of Illinois Chicago and have had the privilege of serving on a multitude of city, county, state, and national task forces focused on safety, violence reduction, and supporting survivors of crime. I have also served the Illinois Attorney General for the last 7 years as a senior advisor on issues related to crime victims and violence prevention, and I chaired the Illinois Violent Crime Victims Advisory Committee. As a mother of 10 children, I think constantly about the safety of my family members, and in the communities that have been most impacted by federal immigration enforcement, my family members reside. They own businesses, and they are pastors. They are deeply impacted by what has transpired under the current administration. On to the next slide. Clearly, I have spent most of my time thinking about safety and how to create it, how to nurture it, and how to sustain it, especially for individuals that have been deprived of basic safety measures that my children are privileged to enjoy. The ability to walk to school without fear of firearm violence, their ability to play in public parks without exposure to violence, and their ability to grow up in a household free of violence. With that foundation, let me clarify the goals of my presentation. On the next slide. First is to examine the prevailing definitions of public safety and how they are operationalized. Second, to assess whether recent enforcement expansions align with established violence reduction research. Third, to articulate a research-grounded framework of holistic safety. And fourth, to examine safety through the perspectives of individuals who've been harmed by violence. On to the next slide. The current enforcement expansion is explicitly framed as a response to victimization and public harm. I am an expert in victim law. The stated objectives here are protection, preventing future tragedies through strengthened enforcement capacity. As someone who has worked in a clinical capacity at a community level and on policies related to victimization, I question not the intent of responding to the harm that has occurred. I question its effectiveness in responding to what victims need and to what produces long-lasting safety. I think it's important for us to consider policy and enforcement actions through the perspective of survivors. The question is not whether we honor victims, we should. The question is whether legislating from singular tragedies reliably produces collective safety gains. On to the next slide. Naming legislation after victims is a bipartisan and long-standing practice. It personalizes harm and it creates urgency. It also centers policymaking around specific events rather than aggregate patterns. Policy scholarship shows us that crisis-driven legislation compresses deliberation timelines. This does not invalidate such laws, but it does raise calibration questions. We face a governance tension. How do we honor individual suffering while designing policies that maximize safety for millions? To evaluate refinement, we need to examine competing safety frameworks that are currently at play. On to the next slide. Here you have an enforcement-based safety model versus a holistic safety model. The enforcement model focuses on removal and deterrence. A holistic model focuses on stabilization and prevention. The enforcement model measures activity outputs. The holistic model measures outcome shifts in violence rates and institutional engagement. And if we trust the evidence base, we should begin to see where reductions in violence consistently occur. On to the next slide. The components listed here are drawn from cross-disciplinary research across academic areas of concentration. Violence declines when environments become more stable and when high-risk individuals are engaged relationally. Economic stability, environmental remediation, trauma-informed care, and targeted intervention all show measurable effects. And these interventions alter the conditions under which violence occurs. They operate upstream and reduce risk exposure over time. The next slide. The studies cited here, just making sure, perfect, include randomized control trials and strong quasi-experimental designs. They demonstrate measurable reductions in firearm violence through the creation of safe, vibrant public spaces, regulatory policies related to firearm access, targeted community violence intervention, and alcohol reduction. Many also demonstrate cost savings and improved health outcomes. It's not just about reducing victimization, you're also reducing the taxpayer burden for violence that could have been prevented. The key insight here is that violence reduction is achievable through calibrated evidence-based prevention strategies. And while enforcement is a tool, it is not the only empirically validated and supported one. To understand why this matters at this moment, we must also consider how survivors themselves construe safety after harm. My research specifically explores the experiences of survivors of firearm violence and families of homicide victims. And if in theory the stated aims of the federal enforcement activities is to address harms in the communities most impacted. Here's what we can tell you about the research on Latino survivors of firearm violence. Next slide. We know that Latino communities experience disproportionate firearm victimization in many states. They face high trauma burdens with low formal service utilizations, and that engagement patterns are shaped by perceived risk, trust, and access barriers. When survivors anticipate negative collateral consequences, engagement declines. Reduced engagement affects reporting crimes, witness participation, and long-term recovery, and these behavioral responses negatively influence the public safety outcomes we care so much about. On to the next slide. So holistic safety that is inclusive of the experiences of survivors of violence is a rational decision that includes trauma stabilization, which increases institutional engagement, accessing culturally responsive services like those you've heard from today, which increases help seeking, economic and housing stability, which reduces vulnerability to reduce victimization, community-based violence intervention strategies, which strengthen relational trust. These factors create survivor-centered holistic safety. On to the next slide. What I hope you take away from my brief presentation is when the means undermine the aims of community safety. The Illinois data cited here and raised by other expert panelists questions the targeting and proportionality of the enforcement activities. If the enforcement activities, which have been documented to do so, broadly affect individuals without violent histories, the intervention is not precision-based and definitely not evidence-based. The reports confirm widespread fear and terror, which research documents actually reduces the reporting of crime and institutional cooperation. And if reporting declines, prevention capacity weakens. Therefore, enforcement strategies should be evaluated not only by activity levels, but by downstream safety indicators. The means here are undermining the aims. What I hope you walk away with today from my brief presentation is that the activities of the federal immigration enforcement expansion in Illinois is producing contrary effects to what best serves victims of violence. It is destabilizing communities through traumatizing youth, families, and their engagement with public institutions, and producing more victimization. Thank you.
Thank you, Dr. Bocanegra. Move next to Deputy Mayor Gary and Gatewood.
Good morning. Thank you to the Commission Chair and the Vice Chair for the opportunity, and all of the commissioners here this morning. Thank you for the opportunity to testify on behalf of the City of Chicago and Mayor Brandon Johnson. It's an honor to appear before this body whose work is essential to strengthening accountability and public trust across Illinois. I'm here with a clear message. Chicago is safer than it was a year ago, and the data shows it. We've taken a disciplined approach to the implementation of the People's Plan for Community Safety, where we have been seeing meaningful, measurable reductions in violence across our city. We were experiencing those declines well before Operation Midway Blitz. We were experiencing those declines well before I, and along with my Director of Violence Prevention and Community Safety and over 30 members of the Chicago Police Department and countless community members were tear gassed by federal agents. Over the past year, Chicago experienced sustained downward trends in key crime categories, including shootings, homicides, and carjackings, marking one of the most significant year-over-year improvements in the history of our great city. As many of you all know and have heard, the city of Chicago had the lowest number of homicides in 60 years. That's 6 decades. That doesn't come from federal agents visiting our city and terrorizing community members. April of last year, we had the lowest number of homicides in any single decade, in any month in any single decade. In May, in June, in July, we had the lowest number of homicides. We actually decreased our homicides, and it'll be on the slides later on, by over 150 over the summer, which marked the lowest level of violence in the summer for Chicago in 60 years. Keep in mind that Operation Midway Blitz started in after the summer, despite the fact that they sent internal emails claiming success for the decline in violence in the city of Chicago over the summer. Our progress is grounded in data. We have strengthened our citywide violence intervention ecosystem, expanded our crisis response and our behavioral health supports, increased our youth employment and re-engagement opportunities, and we have improved cross-agency coordination. These efforts are producing real outcomes: fewer shootings, fewer victims, and safer neighborhoods. We know that this work is far from finished, but the trajectory is clear, and it was clear well before Operation Midway Blitz. We are moving to a safer city. We can deliver a safer city, a more stable city for every resident. I'm going to take a moment to share some details about our work and how we structured our work. So we'll start going through some of the slides. We can go back here. So tell you a bit about the Office of Community Safety. This was established on the mayor's first day in office back in 2023. We are, and my job description says, to eradicate the root causes of violence. So it's not a heavy job at all. You know, we just go in with a regular day, get things done. So really, our work is really focused on eradicating the root causes of harm and also building out rapid responders across the city when we see violence and how violence interacts. You can go over to the next slide. The People's Plan for Community Safety is the structure in which the city operates under our leadership and guidance. We work with our partners in business, philanthropy, community-based organizations, research. In fact, both of these brilliant women next to me help with the People's Plan of Community Safety and continue to help us on a daily basis. On the next slide, you will see the structure of what our plan is and was. And again, I want to reiterate, this level of detail was well before we had any federal intervention. We broke our work down into our people-based work and our place-based work. Our people-based work focuses on youth of highest promise, adults of highest promise, and victims and survivors of crime. Our place-based work, which is focused on eradicating root causes, focuses on education, gender-based violence, community environment, victim and survivors, economic opportunity and upward mobility, health, policing, and community violence intervention. All of these factors work together in different spaces. In fact, we were audacious enough to launch 18 working groups all at the same time that still meet bi-weekly and have been meeting bi-weekly since the year of 2023. We can go to the next slide. These are some of the headlines that we saw throughout the last year. Again, regardless of what the current occupier of the White House and his administration has said, we were experiencing these declines well before Operation Midway Blitz. We experienced declines during Operation Midway Blitz because we continued our disciplined work around what they were doing. And I would be remiss if I didn't highlight the actual good work that we were doing with federal partners in the ATF, in the FBI, not related to immigration enforcement, but the Crime Gun Intelligence Center to remove illegal guns from our streets, to hold gun manufacturers accountable, to hold gun traffickers accountable. Again, all of this work was happening prior to, again, Operation Midway Blitz. And we can move over to the next slide. And I know it's important to really talk about the impact of what it meant to have federal agents on our streets in Chicago, how that impacted residents, how that impacted our staff, how that impacted the city. We built out a network alongside the state, the county, and many leaders and communities to build out what a response was. We have a phenomenal team in our Chicago office, the Immigrant, Migrant, and Refugee Rights team that's led by Beatrice Ponce de Leon, who's been an incredible partner and an advocate in this space. We've been able to work together to build out our rapid response models. Literally, every time we saw a federal response, we'd work with ICER and other partners to deploy resources. The Chicago Police Department is always going to be called to those scenes, and it's important to note that the police department, the Chicago Police Department, is there for crowd control and to help keep people safe, never to support immigration enforcement. You have seen in other areas of the state and other areas of the country, things get really violent and results in the death of citizens who live their lives. We have been fortunate in Chicago that we have not experienced inside Chicago city limits. And that comes from intention together. The work is not always. We are always open to work together to continue to drive violence down, and bodies like this can help and maintain accountability. We have bad actors. The mayor has released several executive orders to create level of accountability. City, those models have been replicated in parts of the country. We stay in constant communication with Minnesota, LA, New York, so many parts of the country that have experienced these incursions of the government, and we'll continue to do that while also continuing to maintain our lines and violence. That will continue to be our focus. That has been our focus, and that won't stop because of the federal government. Find creative, find ways to be responsible, and continue to do that. One thing I think is very important to note before we pass it over to Dominic McCord. We're going to continue to show up for every person in Chicago. We want people to continue to call 911 when they feel threatened. It is our responsibility as a city to provide resources and support for those who are in need. We will continue to do that. And if you ever feel threatened, please don't hesitate to call 911. And as many people around the city do, you can always call me directly as well. So it's an honor to be here. Look forward to more conversations and questions when the opportunity presents itself. Thank you.
Deputy Mayor, thank you so much. We will again reserve questions for all three of you to the end. And next is Dominic McCord, representing CVI and the Metropolitan Peace Initiatives.
Members of the Commission, I thank you for the opportunity to share my observations regarding Operation Midway Blitz as I view it through the lens of public safety. My name is Dominique McCord. I serve as the Chief Program Officer at the Metropolitan Peace Initiatives, MPI, a division of Metropolitan Family Services. MPI convenes Communities Partnering for Peace, CP4P, a coalition of 15 local organizations providing community violence CVI services in 28 neighborhoods across Chicago, including predominantly Hispanic neighborhoods such as Little Village, Humboldt Park, Brighton Park, Back of the Yards, and more. CVI is an evidence-informed, non-punitive public health approach to reducing gun violence. Our organizations offer a suite of services that proactively engage individuals with the highest likelihood of being involved in gun violence. Since joining MPI in 2017, I have witnessed firsthand how our strategies and efforts on the ground at the heart of our Chicago neighborhoods have greatly impacted the city's residents. CVI is working, and it is worthy of becoming a permanent fixture in Chicago's public safety ecosystem. I want to take you all back to August of 2025, before the launch of Operation Midway Blitz on September 6th, before the increased levels of fear in Chicago and across Illinois, before the unwarranted violence and threats, before families and lives were torn apart. Prior to Operation Midway Blitz, Chicago was experiencing a significant decline in violent crimes. According to the city's violence reduction dashboard, in August of 2025, homicides and non-fatal shootings were both down 24% compared to the same period in 2024. Chicago also came off of one of the safest summers in 60 years. More specifically, communities that were directly targeted by Operation Midway Blitz experienced a significant decline in violent crimes, demonstrating that Chicago was on the right track before the operation got underway. Our data shows that Little Village saw 65 fewer shootings in 2025 compared to 2024, a 58% reduction. Humboldt Park experienced a 35% decline in shootings from 2024 to 2025. The 9th District, which includes Brighton Park, also saw a 35% drop in shooting victims. The dedication of professionals in our Communities Partnering for Peace organizations provide a holistic suite of services that start with street outreach. This is a proven strategy that helps prevent shootings before they start. CP4P organizations also provide key wraparound services such as case management, victim services, behavioral health to support residents in their time of need. We're seeing these results, we're also seeing results, give me one second. We're also seeing results from Northwestern University Center for Neighborhood Engaged Research and Science Corners that indicates from July of 2017 to December of 2021 that the work of CP4P prevented at least 383 fatal and non-fatal shootings around Chicago and prevented 605 arrests for violent crimes. In 2025, areas supported by Communities Partnering for Peace saw significant declines in fatal and non-fatal gun victimizations, with 26 out of 28 neighborhoods served experiencing reductions compared to the previous years. In fact, 20 out of the 28 neighborhoods served saw reductions larger than the citywide averages. Overall, CP4P has been found to consistently reach the right people, lower rates of gunshot victimization among participants, improve access to employment, education, and other services, which in turn leads to safer neighborhoods. While one shooting is one too many, there is still much work to be done. We would be remiss if we did not highlight the progress that has been made within community violence intervention. We don't do this work alone. We are proud of the essential role that we're playing in Chicago in making Chicago safer for all. I want to shift for a moment to when Immigration and Customs and Border Protection agents came into town. We saw their extreme tactics play out in real time with warrantless arrests, surprise raids, shooting incidents, and other unthinkable actions against families and children. Through speaking with my staff and my own personal encounters, I began to see the very communities we support shrink. Once bustling streets were empty for fear that ICE would conduct a sweep or make arrests. We saw attendance in schools drop in communities with increased enforcement. Employees were terrified to go to work, and businesses temporarily closed or shuttered as a result of this activity. And trauma began to seep into communities that were already heavily trauma impacted. Our target population is individuals who are at the highest risk of experiencing gun violence. These actions of ICE only further deepen the wound of trauma and fear. Allow me to offer a personal moment that sticks out in my head. The Mexican Independence Parade in Little Village, which is an annual celebration that brings together thousands of proud natives and Chicago residents, honoring the city's rich Mexican culture. It is a vibrant and joyous occasion for all to enjoy. Last year's parade took place shortly after Operation Midway Blitz got underway. I, along with colleagues from MPI and CP4P, marched in the parade as a show of support and allyship. Making our way over to the famed 26th Street, I can only describe the streets as eerily clear. On a Sunday morning, when most would be headed to the grocery store on their way to church, felt like a ghost town. When I finally arrived at the parade, I was pleasantly surprised and stood in admiration of the throngs of people who decided to show up. The pride at the parade was palpable. There was music, there was dancing, smiling, and support from the community. Yet, there was a looming cloud of ICE in our city. Whether lining the streets or hanging out of the windows of their homes, attendees made their voices heard with defiant chants and anti-ICE signs. A day that should have been spent celebrating Mexican history and traditions was interrupted by the need to protest unjust actions against their neighbors and communities. This is just a small example of one of many that shows the effects of a city under siege. Looking ahead, we don't know what's to come from the administration or immigration enforcement. The word of a spring surge is spreading. Meanwhile, the trauma still lingers. What I do know is that the Metropolitan Peace Initiatives and Communities Partnering for Peace will do everything in our power to protect our most vulnerable neighbors. The sense of normalcy, security, and trust has been broken, but we are here to support and restore. Throughout Operation Blitz, our Communities Partnering for Peace organizations conducted multiple Know Your Rights campaigns and trainings. Some of us delivered groceries to families who were fearful of leaving their homes. We distributed whistle kits to community members and created a rapid response team among our CVI network. We additionally offered grief support groups and vital supports that are accessible, hyper-local, and culturally responsive. Some might think that our efforts are a departure from our typical CVI strategies, but it's all rooted in our goal to make Chicago one of the safest big cities in America. We refuse to allow Operation Midway Blitz to undo the progress we've seen over the last few years. We are still showing up, organizing, protesting, and caring for one another. We are still here for our communities, and we always will be. Thank you.
Thank you for the powerful testimony. Turn it to the commissioners. Jimmy?
Yes, thank you, first of all, for testifying today. As a former federal prosecutor, the public safety issue is of particular interest. I appreciate the testimony and the statistics about the decline in violent crime in the city of Chicago that preceded Operation Midway Blitz. I have some questions about the effect of Midway Blitz on the community with regard to public safety. In particular, Commissioner Estrada noted, anecdotally at least, that there's been a decline in 911 calls. Is that something that the city is tracking? Does the city have information about the decline in 911 calls during that time period, especially in those areas that were most affected, like Little Village? And one, would they be willing to provide that information and data to the commission as we prepare our final report in April? And then two, I imagine there are other markers and other data points that we can look at. For example, court cases that are missed, the decline in TROs that are filed, subpoenas that are ignored, or jury duty no-shows. Is there any other way that the city is tracking the impact on the community as the result of Operation Midway Blitz?
Yeah, thank you for that question, Commissioner. So, of course, the city has always been tracking 911 calls, the fluctuation rate of those, and what that looks like. So we can talk to our Office of Emergency Management and Communications to see what we are able to share with the commission, and happy to do that. In regards to your other pieces on missed court dates and things of that nature, we can also work with the State's Attorney's Office and the judicial branch to kind of see what those data points were. I think it's also important to note, there were conversations around the lack of calls coming in from particular communities. So we'll make sure we can look at each of those areas and also look at the declines in crimes in those areas. And we'd be happy to share that. That wouldn't be a problem. So I'll talk to, again, OEMC, and we'll get back to you.
So my question would be, is there any way anyone can legitimately claim that Operation Midway Blitz reduced crime in Chicago at all?
Absolutely not.
Next question would be, this is based on my experience as a federal prosecutor, as a federal judge. I'm well aware that ATF for a long time did some very fine work eliminating guns in Chicago. It's a tough job. Is there any sign that cooperation with the city of Chicago was reduced during Operation Midway Blitz?
Yeah, unfortunately, we saw some of the ATF agents have to be deployed into the Operation Midway Blitz work. So that did put a slowdown on some of the work that we've done with the Crime Gun Intelligence Center. That work was just monumental. And just to talk a bit about that work for a second, the last 4 officers who were killed in the line of duty, we all worked with the CJIC to help bring closure to those families and those cases by being able to identify those crime guns, to see where else they were used. It's those kinds of pieces of work and the other areas of work where they are using their resources along with CPD, along with other partners, to effectuate warrants and actually get some of these what I call weapons of mass destruction off the streets, assault rifles, Glocks with switches, like the real work that really drives declining violence across our city, the work that so many people don't see. Some of that was interrupted by some of the agents being forced to work in on on immigration enforcement, which is not their skill set, which is not what they were hired to do. And obviously, they have to follow those federal orders, but it absolutely put a hindrance on some of that work. It didn't stop the work that was happening with the Chicago Police Department, our partners in CVI, the Illinois State Police, the county. None of that stopped, but it did put a hindrance on some of our federal partners who continue to do incredible work despite some of the circumstances that they're in.
Thank you. Commissioner Sam.
Good morning. Thanks again for your guys' testimony and the work you're doing around community safety. It's much appreciated. My question is for you, Ms. McCord. The work that you described that the Metropolitan Peace Initiative is doing sounds similar to what Operation Ceasefire does. Do you guys collaborate, or am I?
When we think about the work and how it has evolved, some of the origins of the work that we do in community violence intervention, Ceasefire was one of the original organizations which eventually turned into Cure Violence, which is now Cure Violence Global, but we operate 15 local community-based organizations that do street outreach similar to some of those original works of Ceasefire. But the work has grown to not only include violence interruption, but also case management, workforce, education, victim services, mental health. So it has definitely become a holistic suite of services in helping people on the path to living a dignified life. Absolutely.
Other questions from the commission? Seeing none, Deputy Mayor Gatewood, I want to thank you for your time. Director McCord, thank you, especially since my colleague. And Dr. Bocanegra, thank you for your time. We appreciate you. And again, keep the recommendations coming. We have 2 months to finish this report. Appreciate you.
Thank you all for the opportunity.
I'm going to ask the next panelist to come on up. We're going to invite the city clerk, Ana Valencia, Executive Director from Enlace Chicago, Marisela Rodriguez, and Mike Salvatore from the Heritage Hospitality Group to please come up. All right, thank you very much. So we've now examined health, schools, and public safety and trust. Each of these reflects whether communities felt secure. But there's a clear indicator of safety, and that's economic stability, and that's what our next panel is going to talk about. When families feel secure, they go to work. When workers feel safe, businesses stay open. When neighborhoods feel stable, corridors thrive. If enforcement actions truly make communities safer, we would expect economic participation to strengthen and not contract. Yet many business owners, workers, neighborhood organizations describe staffing disruptions, revenue loss, reduced foot traffic, and lingering stability. Economic vitality is not separate from safety. It is one of its clearest expressions. The final panel helps us complete the record. It allows us to examine whether enforcement actions fortified household stability in local economies or whether they introduced new vulnerabilities that communities are still navigating today. So it's my pleasure to introduce the panelists. Again, I just named them, but we're going to begin with our city clerk, Ana Valencia. Ana?
Thank you. Hello, I am City Clerk Ana Valencia, and thank you to the Illinois Accountability Commission for your work on this deeply important topic and for inviting me to share what I've observed in our communities. The economic impact of cruelty always runs deeper than what's at the surface. We are here to advocate for certain communities because they are in harm's way, but also to highlight the reality that there are also direct impacts for those who celebrate or feel removed from these attacks. As our immigrant communities struggled with being targeted by their own federal government, I wanted to find a way to take action and give people more ways to support their communities. Shopping in solidarity became a way to encourage people to explore and spend in neighborhoods that were hit the hardest by immigration raids, and continues to grow as an effort to support Chicago's local businesses across the city, especially as we continue to encounter the multitude of ways the federal government is making it harder to maintain economic stability. During our Shopping in Solidarity events, I spoke directly with small business owners. The day spent in Little Village was particularly impactful. For those who are unaware, the Little Village 26th Street commercial corridor generates the highest tax revenues in Chicago outside of the Magnificent Mile. This Mexican neighborhood on the southwest side is only second in tax revenue collected to a high-end business corridor. In unprecedented times, the streets are crowded. Parking is almost impossible to find, and you'd be pressed hard to walk down the street without passing a tamale stand or street vendor. When I visited in November, it was an unseasonably warm, sunny day, and the streets were virtually empty. A place that once reflected the culture of the homes many immigrants left behind was now reminiscent of a ghost town. Not because it was in our collective best interest to distance ourselves, but because federal agents were let loose in our city with nothing but talking points, hate, and guns. We visited several shops that day and heard directly from business owners about the impact that ICE enforcements have had on their community. Some stores were operating with the doors locked and looked before even opening their doors. Several shops said that their sales were worse than that they were during the COVID-19 pandemic, because this time there are no PPP loans, stimulus checks, or other government assistance. Like any crisis, there are also underlying issues compounding with the new problems brought about these immigration raids. Some of these small business do not have the resources set up for measures such as offering delivery or allowing people to purchase gift cards. Los Camales, one of my favorite taco spots in the city, described low foot traffic and slow sales, forcing them to cut back on employee work hours. Other stores said their sales were down 60 to 70%. We spoke with Mike Moreno Jr., owner of Moreno's Liquors and Ositos Tap, who shared that there's a larger challenge for newer businesses to stay afloat during times of economic instability compared to businesses like his, which have been in Little Village for decades. We know these negative economic impacts will cause ripple effects throughout the city, state, and country. When people are not able to go into work or shop at stores for fear of being picked up by ICE, they cannot participate in our economy. In Illinois, the GDP of Latinos exceeds $100 billion. Latinos paid more than $90 billion in federal, state, and local taxes in 2025. Their spending power and tax contributions help fund social services. As mentioned earlier, the 26th Street commercial corridor brings millions of dollars in sales tax, a significant contribution to our city and state budgets. The story of the current economic impact will tell itself when the 2025 tax season comes to a close in April, but we don't need those numbers to know how this story ends. History has shown us that when immigrants are targeted and deported, the economy as a whole suffers. In the 1930s and 1950s, similar messaging and policy decisions were made on the basis that removing foreign workers would reduce unemployment, raise wages for citizens, and allow citizens more access to social services. Between 1929 and 1934, at least 400,000 Mexicans returned to Mexico through forced self-deportation or government deportation during President Herbert Hoover's administration, which invoked the slogan, "American jobs for real Americans." Some researchers estimate the number was closer to 1.4 million people. What resulted was a severe labor shortage that led to further decline in the employment rate and decreased wages even in sectors that were adjacent to what was traditionally Mexican labor sectors. Purchasing power declined, businesses closed, and the economy was weakened. In the 1950s, President Dwight Eisenhower launched Operation Wetback. The cruelty did not end with the name of the operation. Using eerily familiar strategies we're seeing today, the government used military tactics to apprehend immigrants and often sent them to areas in Mexico where they were not actually from, without any of their belongings or any ability to contact their families. The government boasted that 1.3 million people were deported, though historians say that this was likely inflated and the number was probably closer to 200,000. President Trump has often cited this operation when lauding current deportation tactics and policies. Interesting at the time, many Mexican Americans who were documented supported Eisenhower and his immigration operation when it was first proposed, convinced that they would receive higher wages and more job opportunities if there was less competition with undocumented Mexicans. However, as the project ramped up, this support wavered as the operation was devastating their neighborhoods, disrupting their businesses, and fanning racism against Mexicans. Ultimately, the funding for the operation ran out, the government shut it down, and declared it had been a success, with little to no evidence around economic improvement or even how many people had actually been deported. The Joint Economic Committee's Democratic members estimate that deporting the approximately 8.3 million undocumented immigrants in the United States could reduce United States GDP by 7.4% by 2028. We can continue to divide on the rhetoric, but we'll all be paying for the short-sighted and barbaric actions, showing once again that our liberties and livelihoods are bound together, whether people like it or not. While I'm confident the numbers will show the economic value of immigrant communities everywhere, this is about something much deeper than economic issues. This is an attempt to break the spirit of people who built lives here in spite of language barriers, racist policies, and hate. People who have created strong communities because what can't be snatched away is the way they care for the people around them. The welcoming nature that has given us a peek into so many cultures from around the world, and the understanding that a moment of celebration is priceless. Seeing stores like Dulcelandia, which sells Mexican candy, piñatas, and party supplies, empty. Stores selling quinceañera dresses, empty. Restaurants, panderias, and other gathering places empty, is a reminder that what they really want to take is our culture, our joy, and our humanity. And instead, they're leaving trauma and heartbreak in its place. I want to shout out some journalists that have been documenting more of these stories, and I encourage all of you to check out their reporting. They provide a lot of detail into the experiences of immigrants and business owners affected by these raids. Some journalists I have found particularly impactful are Arciela Gomez Aldana, Michael Puente from WBZ, Jimena Beltran Quain Q, Amy Lee from the Sun-Times, and Francia Garcia Hernandez from Block Club Chicago. The Trump administration doesn't aspire to make America great. It aspires to destroy the greatness that a more just United States holds. And as the weather changes, they'll continue on their reckless mission. ICE will be back in Chicago in 2026, maybe as soon as next month, and we have to prepare. The city needs to create a fund that supports small businesses, not just in response to ICE, but for a perpetual investment in the local businesses across the city. We need to look at reforming fines and fees to alleviate financial strain on businesses and residents alike. It's time to reflect on citation policies like failure to display a business license or snow removal or grass height, and evaluate if education can give businesses a chance to rectify these situations before adding to their financial burden of these small businesses. We need to provide resources to assist businesses in setting up systems that will allow for delivery and gift card purchases, or make an effort to connect them with entities who can provide that support. We all know that the city is in their own budget crisis, but there is ample opportunity to foster private-public partnerships, and if this sector of the economy fails, we know it will hurt everyone. It stands to reason that by setting these businesses up for success, even beyond ICE enforcement, that everyone stands to benefit. Thank you.
Thank you, Clerk Valencia. Marcela Rodriguez, please, your testimony.
Good afternoon, everyone. Members of the Commission, Thank you for the opportunity to provide testimony regarding the economic impact of immigration enforcement actions on businesses and families in Chicago's Little Village community. I also want to thank all that have submitted testimony and to the Commission for documenting all of these information, as it is going to be important for history to remember what happened and how we hold people accountable for their actions. But it is even more critical that we don't forget how we once again persevered and healed regardless of what they do. We know that our communities are resilient, they're beautiful, joyful, culturally rich, and we will continue to move on. I am Marcela Rodriguez, an immigrant and Executive Director of Enlaces Chicago. The information that I will share with you today is grounded in direct business owner responses from the Little Village businesses along the 26th Street Commercial Corridor and the surrounding side streets within the Little Village community, as well as documented data from our Emergency Family Support Fund. What Little Village has witnessed and experienced is not an isolated disruption. It is not targeted safety efforts. It is targeted community-wide business destabilization and household economic hardship occurring simultaneously, driven by sustained fear, deportations, and the broader climate of intimidation associated with immigration enforcement activity. In response to the significant financial hardship facing families and small businesses in Little Village, following increased immigration enforcement activity, Enlace launched the Roots of Resilience campaign to mobilize immediate community support. Central to this effort, we launched the Family Economic Support and the Small Business Microgrant Initiative. We created that to stabilize families and businesses, particularly small businesses that had been in operation for 5 years or less, experiencing sudden economic disruption. Together, these strategies provided immediate relief that reduced the risk of displacement and closure during volatile periods, offering temporary stability while the community continues to recover. In these efforts, we spoke to approximately 130 businesses who reported immediate and sustained disruption to daily operations during periods of enforcement activity. Operational impacts included having to maintain locked doors when ICE and CBP were present, closing entirely on days with zero foot traffic, closing or reducing store hours due to staffing shortages, cutting employee hours due to revenue shortfalls. Several described operations in survival mode, adjusting hours daily depending on whether customers felt safe leaving their homes. Out of the 130 plus businesses that we spoke with, most reported significant revenue loss. Documented declines from 70 businesses ranged from 40 to over 70%, with some businesses reporting 100% loss of sales in certain days when ICE was present. Patterns included sustained 40 to 50% losses for over 2 to 5 months, a 70% revenue decline continuing months later, foot traffic reductions of 50% or more, and ongoing deficits since September. For small family-owned businesses operating on thin margins, a sustained 40 to 70% revenue decline is not temporary hardship, it is existential. The fear was the primary driver of economic withdrawal. Businesses reported employees living in fear, staff not showing up to work or quitting due to safety concerns, customers avoiding the area entirely, an entire commercial corridor sitting empty during peak hours. In addition, businesses that rely heavily on regional Latino tourism were also significantly affected. For example, quinceañera dress retailers, where approximately 60% of customers travel from outside our state, including Michigan, Nebraska, Ohio, New Jersey, and Minnesota, reported appointment cancellations for dress fittings and sharp decline in sales. These cancellations reflect not only local customer withdrawal, but also the loss of destination-based commerce that draws families from across the Midwest and beyond to Little Village. The enforcement climate, therefore, impacted both neighborhood-level economic activity and out-of-state tourism revenue tied to cultural events. While many owners attempted to avoid layoffs, some were forced to reduce employee hours, lay off newer employees, reduce store hours, cover payroll and rent out of pocket, and operate without paying themselves. One business has already announced plans to close if conditions do not stabilize, and other report being on the brink of closure. In response to the food insecurity we've experienced in Little Village, and due to SNAP benefit cuts, increase in tariffs, and Midway Blitz, we secured grant funding to provide grocery assistance to families in need. We intentionally sought to purchase grocery gift cards from the local Little Village grocery stores in order to stabilize households while simultaneously injecting revenue back into the neighborhood economy. This effort revealed an additional layer of vulnerability within these businesses. Of the 6 local grocery stores that we approached, 4 did not have the operational capacity or systems in place to issue gift cards, despite the immediate revenue that such purchases would have provided. Ultimately, we were able to purchase $10,000 in grocery gift cards from 2 local grocery stores. However, the limited ability of several stores to participate underscored how fragile and under-resourced some businesses have become. This experience demonstrated that economic mobilization and stabilization must operate on both sides of the equation, supporting families while ensuring that small businesses have the infrastructure and liquidity to participate in recovery efforts. The destabilization of immigration efforts also translated into family-level crisis. We established the Little Village Emergency Family Support Fund. Through the Emergency Family Support Fund, we documented direct household impacts where 84 families, average size of their household 4, received emergency assistance totaling $112,500. Approximately 73% of those households lost income. 23% cited immigration-related emergencies. And the remainder experienced unexpected crisis events compounded by enforcement conditions. This means ICE efforts affected an estimated 300+ individuals across the households we supported alone. And that reflects only those who were able to receive assistance. The assistance we provided was used for rent and utilities, primarily, groceries, clothing, and in limited times, legal fees. Over half of these families required assistance for both rent, utilities, and groceries, and nearly all requests involved housing stabilization. Some families required multiple basic needs simultaneously, supported with cash assistance and grocery cards. Unlike during COVID, no structured emergency stabilization program has been activated at scale. Businesses reported no form of relief available or accessed, lack of awareness of available supports, reliance on personal savings, and informal family networks. And due to absent rapid response economic interventions, the burden of stabilization fell on individual business owners, workers by absorbing reduced hours, families risking eviction, and community-based organizations mobilizing limited emergency funds. All of the unfortunate events I have shared with you this morning are not temporary. Businesses continue to report sustained 40 to 50% revenue deficits, reduced staffing levels, ongoing fear of future enforcement waves, and risk of permanent closures. Families continue to struggle with housing stability, economic volatility, and ongoing financial fragility. The enforcement activity resulted in measurable and severe economic destabilization across both businesses and households in Little Village. Amongst the businesses we visited, 7% experienced revenue losses of 40 to 49%. 44% experienced losses of 50 to 69%, and 49% experienced losses of 70% or more. We also documented store closures, workforce reductions, widespread customer withdrawal, and employee fear. Businesses hesitated to share basic information in order for us to provide financial assistance due to fear, even when that information was necessary to access urgent economic assistance. We were able, through support of philanthropic partners, to provide $264,000 in direct financial assistance to businesses and families. It is important to note that the data likely understates the true impact. Many businesses were afraid to disclose financial details or formally document their losses, even when doing so would have qualified them for some support. The impact is real, measurable, and continues to affect both businesses and family today. Communities should not be forced to choose between public safety or economic survival. It is our collective responsibility to ensure that stability, dignity, and economic security are protected for all of Illinois residents. Another example of community coming together to support each other. In January, business owners came together to raise funds through the Todos Ponen benefit organized by chefs Diana Davila and Marcos Carvajal from Carnitas Urapan. This effort brought together more than 40 Chicago restaurants and partners to raise funds to stabilize immigrant families and local businesses in crisis, demonstrating the very safety net we need the government and philanthropic partners to match through intentional investment and reinvestment. Lasting economic security requires partnership and action at the state and municipal levels. We need intentional public investment to establish a reliable economic safety net that protects families, stabilizes small businesses, and safeguards the commercial corridors that anchor our communities. One suggestion for policy is, we all know that Little Village has one of the highest revenue generating corridors in the city. Through other economic shocks that we've experienced, such as COVID, the migrant influx, and now Midway Blitz, the 26th Street corridor generates an estimated 30 to 40 million annually in sales tax revenue. Our ask is simple. Reinvest 5% of the revenue already generated by commercial corridors to create a permanent economic stabilization and recovery fund. This will protect small businesses, jobs, and the tax base. If businesses close, city revenues decline. By reinvesting in revenue-generating communities, revenue is preserved. Support small businesses, protect jobs, and fund tourism and confidence-building efforts. This requires no new taxes, just fiscal alignment. If neighborhoods sustain the base and serve as cultural tourism engines, they should not remain exposed to predictable economic shocks. Thank you for your attention to the documented economic and human impact experienced in Little Village.
Director Rodriguez, thank you very much. I'm going to move us next to a pinch hitter. Thank you so much for willing to come up and represent the business community, Mr. Salvatore, representing Heritage Hospitality Group.
Yeah.
Thank you.
Good morning to the Commission, and thank you for the opportunity to speak today. My name is Michael Salvatore. I'm the owner of Heritage Hospitality Group. I'm here today as a small business owner, but I also come here with a perspective where the worlds of privilege and vulnerability collide. I am a proud fifth-generation Chicago kid who grew up on the city's north side in Edgewater and Rogers Park. I'm also the proud son of an immigrant from Peru. I've been fortunate enough to grow my business locally, but I'm fully aware, and I carry this with me every single day, that much of my success has been built on the backs of my employees, and many of those employees are immigrant to this country. To understand the impact of Operation Midway Blitz, you first have to understand what it means to run a small business on a normal day. On our very best days, our margins are thin. The biggest hurdle we face is constant uncertainty, whether it's the economy, labor, or supply prices. Running a business is a day-to-day shuffle of mental gymnastics. When you throw in something like the tyrannical immigration enforcement of Operation Midway Blitz, the challenge of running a business are compounded by a very real, very heavy mental toll. And that toll wasn't just professional, it reached into my own home. My kids, Bennett, who's 14, and Owen, who's 10, were afraid for me to be out and about in the city. They were terrified I might get taken, and frankly, I carried a very real fear that my mother, an immigrant from Peru, could be mistakenly swept up by ICE agents. If that level of anxiety existed in my privileged household, you can only imagine the absolute terror felt by my staff. To run a hospitality group, you need a clear mind, but my focus had to shift entirely to worrying about my team. These aren't just workers to me. Many of them are my friends. They have families. My concern was for my current staff, but also for people who have worked with me in the past, who I still care about. During those months, the disruption took up a massive amount of our mental capacity. We saw immediate practical disruptions. We had staff who couldn't make it in because they needed to stay home and care for our family members who were too afraid to leave the house. We had employees who wouldn't take the train because they were scared ICE was camping out at the stations. The mental health impact of my staff in those months were severe, and it carried over to our customers, who were also preoccupied with strain of ICE in the city and staying away from commercial corridors. Because of this fear, there were days we simply did not have the manpower to operate. We had to close some aspects of my business. We had to pivot to making sure our team felt safe. We established protocols so everyone knew exactly what we could and could not do in the event of an immigration raid. We looked out for each other, even just making sure the streets were clear when our cooks left at the end of the shift. And we knew we couldn't just sit by. When the Blitz started, I teamed up with some fellow local business owners on the west side. We were unsure of what was to come, but we wanted to make sure our neighborhood and our employees felt safe, heard, protected by their community leaders. We launched a campaign and put out a public service announcement to let the city of Chicago know that small business owners were going to stand up to this enforcement as much as we could. I want to end with this. I am highly aware that my specific businesses are located in privileged areas of the city, and that my lived experience right now is not that of a direct immigrant. But I'm using my privilege to be here today to speak on their behalf, because I know that many of the workers and business owners who suffered the most under Operation Midway Blitz do not have the privilege to show up to these events. They're not here today because they're still scared of retribution. The structural vulnerabilities this moment exposed in our neighborhood economies are profound, but the lasting instability it created for our families and workers is something we are still feeling today. Thank you.
Thank you, Mr. Salvatore. Questions for the commission? Commissioner Sesh.
It's always wonderful to hear statistics and specific evidence. And I want to thank all of you for your testimony. And I just want to make sure that we will have copies of your testimony and slides so that when we need to be able to repeat and go over what you've done, that we have that tremendous base in facts and evidence. And I want to thank you, all of you, for being so clear about the devastating effects of these raids on hardworking Chicagoans. So thanks a lot. And Ana Valencia, particularly, thank you for your leadership in the City Key effort, which really went a long way by providing access to city ID for every resident of Chicago to help everyone feel like they belong in Chicago. So thanks a lot for that.
Commissioner?
Quick question with regards to stores, that it was a bustling area and a lot of empty stores, streets are closed. Would you be able to tell us, not in specific, but just as an estimate, how many stores have actually closed permanently versus temporarily shut down when ICE agents are there?
We don't know that yet. But a scary point of reference is that after COVID, we know that in Little Village, 36 stores closed, and that's with a large amount of economic support, both from government and community and philanthropic community. And so we can only estimate and hope that it's not at that level and or worse.
I also want to thank Clerk Valencia, please.
I was going to add to that, too. I think it's a compounding fact, too, because it's not only the ICE raids, we are also seeing the tariffs and what that's done. These Trump tariffs have added the cost of what it means to buy coffee. And so not just even in our immigrant communities, but our economic corridor is sustaining our city. And so we don't have to rely on the federal government as much. And what I also think is very intentional is to shut down our way to be self-sustainable of our own economies of local businesses in Chicago, so that we may have to rely on federal resources. And so I do think that's very strategic, and we have to be very honest about that. That's happening. So as a city, we really have to think about how we're going to be spending our investments and dollars here. To her point of the 5% return from what's coming from Little Village is something the city really needs to take up and consider, of how we remain self-sustainable and these businesses survive.
I also want to reiterate my thanks to the panelists for participating today. One thing that I've always admired about entrepreneurs, having had the privilege of working with them, is their entrepreneurial spirit. And you've given some recommendations as to what we should consider in our report for how to ease the burden of reopening or just staying open for their businesses. What would you recommend in terms of encouraging people to stay in this fight, given how difficult it is to maintain their business, and to create a nurturing environment where they will continue to carry on with what their vision was for their own families and their own businesses here in Chicago?
I think to be very creative. Sometimes financial resources are scarce. And so remembering to pull at our cultural richness and our levels of inclusion and support for one another, I think is really important. I hope that in Little Village we could do more of the coordinated efforts through the chamber where tourists coming into the community and we support each other. But it's tough because unlike COVID, there's nothing really concrete that businesses can look for. I was a small business owner and had to unfortunately close our business, which was a dream of ours. It was a little ice cream shop. And so I ran in Los Angeles, Chicago during the day, and I scooped ice cream for families at night. And I loved it. It was my happy place. And there really was nowhere to go. We depleted our savings. And we unfortunately had to close down after a year of operations. And not just because of Midway Blitz, but there's other things that happen within the life of a business that don't prepare you or set you up for success during outside interruptions like that. And so I think you just have to be creative and try your best to find ways to stay afloat, whether it's, looking at your highest sales hours and only opening up during those hours. We know that ICE and CBP come into our communities during the morning and they're pretty out by like 1 o'clock. So maybe people can change their hours of operation to be later in the evening. And really leaning on each other to support in any way we can.
I also want to lift up, because the city of Chicago is having their own financial issues and with the loss of, COVID funds going away, Business Affairs Consumer Protection had 8 neighborhood development business centers and now have to go to 4. And so those neighborhood development centers and our chambers are really the front lines for our small businesses to understand how to navigate a business license, how to have your business license on the wall, what code and requirements are needed, how to get inspections. And so I think there's a real need. There's funds set aside for the Neighborhood Opportunity Fund for infrastructure dollars, but there aren't really funds for operating on how to change your technology operations, to adding employees, to expanding your businesses, and thinking about these innovative, how to market your business, understanding the social media. And a lot of the chambers offer those classes, but we need them in different neighborhoods, language access, and more availability, and the funding for that is really gone away. And so we need to think innovatively. We as a city can't fund it ourselves, so we need corporate and philanthropy support to do that. And this is where the private sector can really come in to support. And I think this is forcing our hand to do this, but it's been needed for decades. And the investment needs to continue and build up. I don't think we do enough for our small businesses, and we rely on them heavily in our neighborhoods. They're the ones donating to the local school fundraisers. They're the ones donating to our neighborhood parks. They're the ones supporting our communities, but I don't feel like the support is there, especially with 90 business partners we have with City Key that offer discounts for the City Key card. I hear constantly from them, these are the issues that they're seeing, including enforcement as the city citations, business licenses are going up for a lot of businesses because of what's happening. And we've got to figure out how we're not putting more burden and barriers in front of them.
I just want to follow up and say she's absolutely right. It's almost impossible to run a business in a city, in any city for that matter. There's a lot of red tape. Every move we take is analyzed and feels like it's pounced upon. And for the investment in the neighborhoods that need it, or any small business, this money goes back. This money is paid to the employees. With PPP, with Restaurant Revitalization Act, it seemed like a big payday for us, but that went to the building owners, that went to the staff. That was just for us to survive. And for us who didn't get some of that money, had to take out loans from the government that were still paying off. We had to pay them, we had to pay the business owners, or the city, the landlords. So that money you put into these businesses goes back. And there's not a bad investment in small business in this city or anywhere in this country. So I just like to say that, and again, red tape is hard. And any way you can lift that up for small businesses to make it streamlined, which seems like the opposite of what most people want to do, the easier it is for us to make money for the city, to tax us, to give it back.
Vice Chair.
Just really briefly, as Vice Chair of the Commission, I just want to thank you all for your testimony today and all of the individuals who testified. I cannot begin to tell you how much it touched me to hear what you had to say regarding the impact. We think about all the negativity that has come out of this, but what really struck me was hearing, and thinking about a little girl who can't have her quinceañera because of all the violence and because of the, quote, protection that's supposedly being given in these communities. It's an abomination. It's terrible. I think as someone who has a sister who has a small business, she actually has two. One of them started because she was taking people's children to school, and then she decided to, start her own business and provide a transportation service in her community. And I mean, she's just got clients all over the place. To think about not having those clients because they are afraid to go to school, it's terrible. There's nothing good that has come of this, except it has brought our communities together to fight. And so I appreciate everything that everyone has said here today, and I hope that we can continue to join together because diversity is important, equity is important, being included is important, and belonging is important. And we might not have the right to say those words. I'll keep saying them. I don't really care. We might not have the right to say those words, but they are extremely important. So thank you all for everything that you've done to prepare to testify today. We are trying our best to provide as much evidence and information as we can so that hopefully at some point someone is brought to justice regarding these atrocities. Thank you.
Okay, thank you very much for all of the panelists. Thank you, Mr. Salvatore, Marcy, is my friend, colleague, and Ana Valencia, the city clerk, you again. But I think every one of the panelists made the time to come here today. That it is important all the domains, health, education, public safety, economic vitality. And the fundamental question here today is what we've been asking for each of our meetings. Is this narrative around coming here to create a safer community, a safer town, is it true? And the reality is, every public sessions we've heard, it's farce. It's not true. On every single domain, we know it's not true. And we urge you to stay connected to these hearings, to listen and review the tapes of the last hearing. I guess they're not tapes anymore, but the recordings of the last hearings. We've had experts in use of force, experts in chemical weapons usage, weapons that are banned in wartime but are being deployed on the streets of Chicago. We've had experts in governance and training for CBP and ICE, and it's showing us the atrocities that these people are committing, that their criminality rates are higher than the people they are chasing down on our streets. So I urge you to check them out, and thank you for your attention. Today we also want to have a public comment session, and so I'm going to now take the time to call some folks for public comment. Thank you again. Now for the public comment session, we only have 4 speakers today, and they each will get 2 minutes to present their public testimony. So I'm going to begin with, let me make sure I get this right, Emily Wheeler. Emily, could you come up? When you're ready, Emily.
Thank you. Great. Hello, everyone. My name is Emily Wheeler, and I work for a nonprofit organization called the Sanctuary Working Group, or SWG. We are a collective of over 30 different nonprofits, faith communities, and other groups dedicated to supporting vulnerable immigrants in the Chicagoland area on their journey towards sustainable independence. As we have heard from many different experts in their fields, families in Chicago have been terrified to leave their homes, go to work, take their kids to school, or run simple errands. This fear started in January of 2025 and is not limited to only the height of Midway Blitz. In 2025, the SWG distributed over $203,000 of direct support just for housing. In December 2025 and January 2026, in 2 months, we distributed over $85,000 in direct support for housing and USCIS fees.
When people's safety and health are at risk, if they decide to go to work, there needs to be more options for relief than nonprofits, mutual aid groups, and public benefits that have increasingly limited eligibility criteria. Landlords and employers are illegally using ICE as a threat to their tenants and employees, getting away with their actions because most immigrants do not want any litigation to be on their records. On the other end of the spectrum, people on ATD, Alternatives to Detention, monitoring are being denied jobs due to bosses not wanting to endanger their other employees. There needs to be safer options for families to hold landlords, employers, and other forces accountable when their rights are violated, especially for undocumented and mixed status families. The vast majority of families we work with are people who have had the primary breadwinner among them ripped away. During Midway Blitz, we saw landscapers, contractors, and day labor gathering places targeted specifically. This leaves incredibly vulnerable single mothers and other caregivers alone, unable to pay rent or afford groceries, scared to go anywhere away from their children lest they be separated further from their family. The SWG also runs an accompaniment program where we match people to trained volunteers who can accompany them to their court dates, ICE check-ins, and other immigration-related appointments. People are terrified to do what this country has told them is the right way to do things. The immigration court system is the most punitive and harsh it has been in my lifetime. There is no longer any right way to do things. Stress and trauma are making physical and mental health conditions worse, and innocent families are paying the price. Thank you.
Thank you. You took that 2 minutes very seriously. Thank you. Okay, next I'm going to call Kiara Cortez. Is it Kiara? Yeah. You don't have to go quite that quickly. Okay. When you're ready.
Okay. Good afternoon, everyone. Today I stand before you not only as a caseworker in my community, but also as a mother of an immigrant family. I'm here because my director, Maggie Lugo from Casa Michoacan, asked me to share what are my experience. Our organization works in partnership with ICE to support and defend our community. I stand here all day. I could stand here all day and explain how difficult this moment is. But as a community worker and as a mother, the truth is that it's hard to even put into words. I cannot understand how we're still living through so much pain and instability. How a child and a parent can face separation because of the immigration status. How families wake up every day not knowing what could happen next. I have seen children, parents, young adults, and seniors asking for help. I have sat in community cafes having conversation about rights and the steps we can take. I've been inside CPS schools speaking with families. I've accompanied mothers and their children to court in case they are taken by ICE. In this case, I am the person that in case if they're taken by ICE, I notify their families. Every day I answer calls from people who are afraid, people who don't know what to do, people who just want to protect their children. And now families are living with the fear of being stopped, simply because of how they look. That breaks my heart. But the hardest part of my day is answering my daughter's questions at home due to what she hears at school. Reassuring her that she is safe is something a mother will do, and making sure she feels protected every single day. When she has to be transported somewhere else for aftercare, I think to myself, will everything be okay? I stay calm, I plan, I prepare, I do everything I can as a mother. But honestly, who can truly guarantee that everything will be okay? And I know we are not alone. There are so many children and adults asking that same question now. ICER and Casa Michoacan has given us training, resources, and clear steps to continue supporting our community. And even with a heavy heart, we continue to fight because our community deserves dignity, our children deserve safety, and our family deserves peace. Thank you.
Thank you so much. Okay, next, let me call Angela Cedeno. Angela or Angela? Angela. Bienvenida.
Good afternoon. My name is Dr. Cedeno, a clinical psychologist and CEO of Expanded Mental Health Services of Chicago, representing the 260,000 residents of Albany Park, Irving Park, North Park, Logan Square, Avondale, and Hermosa. The impact of the escalation of immigration enforcement has been far-reaching, affecting individuals of all ages. Daily lives have been disrupted in our homes, schools, workplaces, and health clinics. Among the outcomes are separation of families, economic hardship, children being required to stand in for their parents, and parents not receiving the health care they need because they are too afraid to leave their homes. The tactics used have caused pervasive fear and terror that no place is safe and no one is safe, that one could be separated from their loved ones and could die in otherwise safe places. These are concerns expressed by second graders at one of our local schools in reference to violence inflicted by ICE and CBP. Today, I lift the experiences of our children. These traumatic events have implications for long-term harm. As mental health providers, we bear witness to how this chronic fear shows up in our children as nightmares, bedwetting, worry and preoccupation about separation, irritability and depression, social withdrawal, and school refusal. Our teachers and caregivers have found it difficult to console and reassure their children. Our work has expanded to support the helpers and caregivers who are exhausted from working to protect and care for their students and families. On October 3rd, tear gas was deployed at the front door of our mental health clinic. Staff and clients were exposed to tear gas as they went to work and therapy. Neighbors, including elders with asthma and youth, ran for cover. For subsequent months, we could not assure our clients that our location would be safe. All of these assaults on our neighbors have exhausted our resources, strained the social fabric, and threatened the wellness of our communities. We have a responsibility to our communities, but especially our children, to protect and not harm them. Operation Midway Blitz caused relentless harm that will take years and likely generations to overcome. Thank you.
Thank you. And finally, we have Veronica Ortiz. Thank you.
Privilege. Okay. I have the privilege of being the Senior Director of Community Wellness with Enlace Chicago. I've heard today's expert testimony from several professionals whom I respect and revere. My expert opinion aligns closely or even directly with much of what was said today as it pertains to the community, children, and families. I'm now speaking from a place of leadership in an organization that employs frontline members, outreach workers, case managers, community health workers, street outreach workers, parent mentors, school staff, safe passage workers, and agency staff as a whole. We all continue to show up day in and day out under conditions that were outside of our capacity. We showed up when the streets were desolate in Little Village. We showed up when the helicopters hovered above. All of this wreaking havoc on our nervous systems. We still walk around with whistles, which now many of us have visceral responses to when we hear them. We are all part of blended families who are directly impacted by the threats of ICE. We saw an increase in time off requests, which put pressure on staff and resources. We had to establish unprecedented policies that kept our building and our staff safe. Lockdown procedures that seem outside of what would be the norm for any organization. We sat with families who had loved ones detained by ICE. Many of us on several occasions actually witnessed the kidnapping of our community members. In order to respond to the critical impacts of secondary PTSD and compassion fatigue, we as an organization created weekly open spaces for staff to openly express their feelings, receive validation, and co-regulate. Showing up for others when carrying your own compounded traumatic stress is not sustainable. Staff well-being continues to be a priority for us as we continue to ensure that the much-needed community members receive the services we offer. We now ask, how are community-based organizations able to create safe spaces in the communities where we are impacted by compounded traumatic experiences like military action? We ask for continued investments in mental health and well-being in our communities that have been directly impacted. Thank you.
Thank you. Okay. Thank you to everyone who offered public testimony. We know that sharing these experiences publicly is not easy, and we recognize the trust it takes for you to speak into this space. Your words are now part of the public record, and they will inform the Commission's work moving forward. Thank you for showing up. We see you, we hear you, and we honor you. We also want to thank those who listened respectfully and attentively. Creating space for testimony is a shared responsibility. So this concludes the public comment portion of today's hearing. So now it's my honor to pass the mic off to our chair, Judge Ruben Castillo, who, by the way, is not only a beacon of justice in the Latino community, but he is that for the entire state of Illinois and the country. He is just one of the best lawyers and judges that we have. We're honored to have him. Judge, you're up.
Well, thank you for that kind introduction, Commissioner Estrada, and for presiding over this morning's hearing so well. Should have been a judge. You know, I sit here and I think every single time I've spoken, I've asked for your patience, and we're still asking for patience. But more than anything, we're asking for feedback. But do we have that video? We do. Okay, right after I speak? Okay, great. Where have we been? And I'm asking for your patience because as soon as I'm done speaking, I'm going to show you a little bit about where we're going and some things that have been really on my mind. And you can see it's tough to serve on this commission because what we are witnessing time and time again is the pain and the trauma that Illinois has gone through. And then what we've seen through video is how it passed on to Minneapolis. And to see what happened in Minneapolis and now reflecting on what had previously occurred in Illinois is very difficult for anyone, let alone to think that, as I pointed out, children are seeing this and people are asking, how can this be happening of all ages? And people are seeing people killed and seeing people wounded and testifying about that is just a very difficult task for this commission. In December, we established at our first hearing, without a shadow of a doubt, by calling the best expert in the world, that chemical weapons were being misused by ICE and Customs Border Patrol. We did a lot of other things at that December hearing, but we established that. And let alone, you know, in our naivety, we thought that might impact the manner in which ICE and Border Patrol would use these chemical weapons. As Commissioner Estrada pointed out, they're banned, as our witness testified, in warfare, but yet we continue to see these chemical weapons misused, where agents are actually kneeling on people and spraying them in the face, which is totally beyond the pale of anything that's ever been seen. And certainly in my 30 years of federal law enforcement experience, it's just so shameful as to be beyond any type of justification. But what we've seen over the course of this commission being formed is literally one lie after another by the administration and by ICE as to their actions. And this is not just me as the chair of this commission speaking. This is, I can tell you, there have been about 40 judicial opinions from federal court that have caught the administration in different lies about one thing or another, from the very serious involving shootings to chemical agents being used. And I'm very proud of my former colleagues on district courts who were appointed by all kinds of presidents, Republican and Democrats, who have called out this administration for the lies they are telling. But December showed chemical weapons being misused. And then we came back in this very room in January, as has been pointed out, and established what the history of Border Patrol has been. And we found out without a shadow of a doubt that these shootings have been going on for ages along the U.S.-Mexican border. And people are being killed and are still, to this day, being killed. So what we saw in Chicago with poor Mr. Villegas Gonzalez in September is no accident. It's a pattern. It is a pattern. And we're going to see this in this video that we're going to show. It's a pattern. And it is a very scary pattern of abuse with no discipline, with no accountability, with no oversight, that I can tell you in no uncertain terms needs to be stopped. And it is mixed up with what is the intent? What is the intent behind all of this? Now, the governor asked us last month in January to focus on statements, and we are trying to do that. And I will tell everybody in this audience listening or live here, really evaluate the initial report that we issued at our last hearing. Really take a look at that and look at the chronology, because the chronology says it all. It really does. On September 6, 2025, as shown by the chronology that exists with this initial report, which I can tell you all of the people that I've ever talked about this report have commended how well this report is. And yet, this is only a prelude to our final report. And I will sit here and guarantee to you that our final report will be even better than this initial report, because we might have missed stuff in this report, and this is going to get better. And I'll even point out some things that we missed. But on September 6th, the President of the United States says Chicago is about to find out why it's called the Department of War, and post a photo of himself and says it's going to be Chicago collapse or epiclapse. And he, post a picture of him, unfortunately, with the late great actor from that movie, Apocalypse Now, Robert Duvall. And it's no accident that 6 days later, Mr. Villegas Gonzalez is killed on the streets, supposedly because he was backing up over someone. Supposedly, and keep that in mind, we're going to see that pattern later on. And then a month later, again in Chicago, and this was something even CPD could not prevent, Ms. Martinez. Ms. Martinez probably would have sat in one of these chairs today, but she's going to go to see the president speak at the State of the Union pursuant to an invitation of Congressman Garcia, which is great. But I just wish whatever she's going to see tonight would be the God's honest truth. And my fear is it's not going to be. And if the president dares to say anything about Illinois or Chicago, I seriously doubt it's going to pass any polygraph test. That's what I can tell you. But on September 16th, DH Secretary Noem says, again, in our chronology, says that Mr. Villegas Gonzalez was shot by a brave ICE government officer who was dragged many yards, this is quote, many yards by a car after a criminal illegal alien resisted arrest. His life was put at risk and he sustained serious injuries. That's her version. And we know that their version just doesn't hold up. We just know that because that never happened, dragged many yards, sustained any type of serious injury when that officer himself says, right on the recording, minor injury at best, minor injury. That's what I would tell you. So then we get to, and it's not in our chronology, so I'm telling you, we need to put it in here, the October 4th shooting of Ms. Martinez. She hopefully will be here to testify next month. And that, if there ever was a shooting that broke down in federal court, that is a shooting that you will see pieced together. I've already seen it pieced together. Now it comes out because one of the things that occurred since our last hearing was the judge released all the information, or most of it, about that shooting. And we're seeing it was the agents who decided to bump her car, and we see that they purposely said, okay, you want some, you're going to get some, and then they had a whole bunch of things to say in their emails afterwards, and then it gets even better. Mr. Bonvino congratulates the agent by saying, it was a fine piece of work and we want you to stay on, because he was getting to the end of his tour. That's how they discipline, that's how they investigate. That's what happened there. And then, of course, tragically, that's all I can tell you, because I've seen these videos, so have you. I know everybody here, I'm preaching to the choir, seen the videos of the shootings in Minneapolis. And all I can tell you is there is a direct connection between what happened here in Illinois and what happened in Minneapolis. And I said this last time, if those shootings in Illinois had been investigated and disciplined, maybe Minneapolis doesn't happen. But then right in our chronology, again, in between, after the Martinez hearing, October 24th, Deputy White House Chief of Staff Miller says, from his point of view, ICE officers have federal immunity in the conduct of their duties. And anyone who lays a hand on you or tries to stop you or tries to obstruct you is committing a felony. You have immunity to perform your duties, and no one, no city official, no state official, no illegal alien, no leftist agitator or domestic insurrectionist can prevent you from fulfilling your legal obligations and duties, as these agents are being egged on. And that, I think, is what you're going to see in the video. But then, unfortunately, oh my God, unfortunately, this gets even worse. Because now it's coming out, I think in January I said, well, there have been 9 shootings since Mr. Villegas Gonzalez was killed. And no one's been prosecuted, and hopefully that's going to change. But now it comes out that there was another citizen killed. And this has just been reported on by the New York Times. And now it turns out that there, on March 15th of 2025, an unfortunate soul, Ruben Ray Martinez, a U.S. citizen, 23 years old, was shot multiple times in South Padre Island by ICE and an ICE officer. And this is what we know about that. Mr. Martinez, he didn't have a criminal history. He was working at an Amazon warehouse in San Antonio, and he was at a birthday party in South Padre Island, and supposedly all of a sudden he tried to run over an ICE agent. And so to the point that supposedly the agent got all the way to the hood of this vehicle, and yet no significant injury. So in my mind, a very questionable, or as my granddaughter would say, shaky story there. Very shaky story there. And a U.S. citizen, and I just wonder how that is that people are getting killed in Texas by the Mexican border and not a whole lot of publicity. And I get it. The two shootings in Minneapolis were both videotaped, multiple angles, and the stories just broke down right away. So we are seeing progress. Mr. Bonvino was shipped out of Minneapolis. Another person was sent in to so-called clean up everything. And it's not lost on me, again, as a former federal prosecutor, former federal judge, the person who was sent in to clean up, well, just look at who that person is, Mr. Holman, who accepted $50,000 in a paper bag from an undercover FBI agent and has never explained what were the circumstances of that. Never had to, because the Department of Justice dropped the entire investigation, dropped it all. And so I know at this point, sitting here as the chair of this commission, that federal agents from the FBI have been redeployed from public corruption to do immigration enforcement. I know, and we heard it today here, that ATF agents who used to clean up the city of Chicago from guns, that were doing a lot of bad things to citizens, are being redeployed to do ICE enforcement. That is the world we live in today. And I think back to one time when I was presiding over a trial, and I saw that Mount Prospect was racially profiling Mexican nationals and pulling them over without any justification. I sent a letter to the Attorney General to investigate. And that Attorney General was Janet Reno. And it got investigated. And next thing you know, Mount Prospect had entered into a consent decree to stop that. And I compare that to the person who is the Attorney General now, who we could never send a letter to prosecute these ICE agents. So that's the world we live in now, and it's a different world, and we have to accept that. And at today's hearing, we saw the devastating mental health problems, the educational problems, the economic problems, just devastating for Illinois. And yet, I applaud Illinois because we have somehow survived, and I can tell you we have helped Minneapolis survive, and there are people in Illinois who are helping other cities, and that's all we can do is go on. So we are on a small and slow path, but a path to the truth and to shed light on everything that has happened. And we need your help to get there, because our initial report needs feedback. Please look at the initial report, give us the feedback, let us conclude with a final report that is going to change things for the better. Let us hope that the people creating this misconduct, creating this devastating mental health world for us, an economic world, see accountability. That's what we're after. That's what every single commissioner is here trying to do. So with that, you can play the video and judge it for yourself. See you.
As he fled the scene. DHS says Villegas Gonzalez drove his car at law enforcement officers, hitting an officer, then dragging him as he fled the scene.
Martinez is a teacher's assistant at a Montessori school in Chicago.
I just saw them like drawing their guns and I just like shrugged and I just heard the shots.
All right, we're following now. All right, out of the car. Be advised, we've been struck. Get out. Don't you f***ing move!
Minneapolis residents still mobilizing after an ICE officer shot and killed a 37-year-old mother.
That's fine, dude. I'm not mad at you.
The agent shot Renee Nicole Good.
She then proceeded to weaponize her vehicle, and she attempted to run a law enforcement officer over. An individual approached U.S. Border Patrol officers with a 9mm semi-automatic handgun. The officers attempted to disarm this individual, but the armed suspect reacted violently.
As the agents advanced on him, he retreated to the side of the street, and that's when he is grabbed from behind. I saw no evidence of him assaulting the police.